Welcome to our June 19th special Board of County Commission meeting. If everybody can stand for a moment of silence and remain standing for the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, this morning, as we always do with our special meetings, we're going to push public comment back till after the presentation for Department 1, coronavirus update. Today we have Department 2, discussion on consideration of a draft emergency order regarding face coverings. And then we have Department 3, we'll be going over grants and aids. And this item has been continued from June 16th. So if I could get a motion to accept the agenda.
Approve the agenda.
Second.
Okay, we have a motion by Commissioner Smith, seconded by Commissioner Hetherington. All in favor?
Aye.
All opposed? Motion carries unanimously. Okay, so today we're going to start Department 1, which is our virus update. We're going to begin with Mr. Rob Lord from Cleveland Clinic.
Good morning, Commissioners, Mr. Chairman.
Morning.
Thank you so much again for the opportunity. As you can see on the board here, I have some just a very few slides. I thought it might be helpful if I could provide some information graphically. I have not done this previously. A very brief presentation contains data just up front from both the Department of Health and from Cleveland Clinic. This slide shows our infections, total cumulative infections over time by county. As you can see, the white line is Martin County, and the yellow line St. Lucie County cases, and that, I guess that's an orange down at the bottom. The takeaway from this slide, of course, is that Martin County still has slightly more than St. Lucie County and Indian River County combined. If you look at that from a population standpoint, when I did the math, you combine the populations of St. Lucie County and Indian River County, and it's right at 3 times the county population of Martin County. So that's a perspective on that. I've heard this attributed to the fact that we have done more testing. Next slide, please. So here's the testing data. Now this is as of the 17th, but it hasn't changed substantially. But as I was putting this together, and just a few takeaways from this slide. First of all, I'm very proud of the role the Cleveland Clinic has played in all 3 of these counties in providing testing. We have been the drive-through test provider since very early on in this process in all 3 counties. This includes our data, but it includes all other data. Again, this is Department of Health data. So what do you see here? First of all, we have tested a higher percentage of our population than any of these other counties. So we are to be congratulated for that. But you can see St. Lucie County has done substantially more tests, as they should, with twice the population. You can see they have not done twice the number of tests. But down at the bottom, that percent positive is the number I would point out to you. 9.7% in Martin County as opposed to 5.6% in St. Lucie County and 2.7% in Indian River. Our sister hospital in Indian River County, I can report to you that we have seen a substantial uptick up there too, so it's as if this thing is moving up the coast, which would make sense. It started with Dade, Broward, and Palm Beach County, and as we all know, they kept Dade, Broward, and Palm Beach County locked down. We opened up first, and people drove up en masse. So we should expect those sorts of things to happen. Next slide. I find this to be, the next couple of slides, to be an interesting slide. This is considered by many to be a disease that affects the aged and the infirm, but you can see the age distribution of COVID cases in Martin County, and these are Martin County residents only. And I've heard speculation that, well, this actually is good data because it's in these last three columns, the 65 and over columns that are considered at high risk. So it's a good thing that we have this distribution, because those patients back in these higher columns are not the ones that wind up in the hospital. They don't wind up very sick. And obviously up here, your 19 to 44 ages, or should be on this, your 25 to 54 leads the pack. Next slide, please. So this is from our system. This shows you the age group of the patients admitted to our local hospitals. And the 0 to 18 is misleading. And I just, not purposefully, it's the way it's worked out, because for those patients to date, when we've had them, we have a difficult time isolating. We have one pediatric unit that it's hard to cohort a patient within that. And we have a relationship with children's hospitals, particularly Nemours, where they have dedicated COVID units for those patients. And I'm just showing you inpatients here. This is not emergency room visits. That would not be meaningful data, I don't think, on this point. So 0 to 18, there are some cases, but they were not hospitalized in our facility. They were transferred to a children's hospital that had a dedicated, cohorted COVID unit. But I want you to look at the age group of the hospitalizations. What this represents, the blue is Martin County residents. The orange is all others. And I would be remiss if I did not stop here and indicate that I apologize for this color scheme as a graduate of Florida State University.
I love it.
I might need to make that a point when I go back to the office. But to my lovely wife at home of 31 and a half years, I would say to Beth, who is an alumnus of the University of Florida, honey, I did this for you. But what does this show us? This shows us that a lot of patients, 19 to 44 and 55 to 64, considered low risk. These are the people that aren't supposed to get sick and wind up in the hospital, I'm being told. And they're the two highest columns. This affects everybody. Now, our treatments have evolved, and we've been much more successful at keeping people alive. And so you're not seeing a lot of deaths in these age groups. Those do tend to be elderly patients. Not all. We've lost some that were younger. But there are potential long-term, potentially lifelong consequences of being so sick you have to be in a hospital, that when you recover, the way this affects lungs and other body organs, we don't know the long-term effects, but it's not going to be good. So I worry about that group. Finally, the next slide. This shows you the trend over time for our hospital admissions. I spoke of this last week, but I thought the graphic representation was just much more helpful. I plugged in those red arrows to try and just give you a date reference. This covers a broad spectrum of time. This begins on March the 12th and ends on the 17th. And you can see that into April, it started to build up, and then things flattened out. Our societal behavior changed some, and it remained pretty low and steady. And then you get to May, and there's a gradual increase there. If you did a 7-day rolling average over that, you'd see a steady upward trend, and then what you would see after June 1st is frightening. And as you see throughout the thing, there's little ups and downs. There's days where we discharge more than come in, but we're far and away admitting more than we are discharging. So I'll repeat what I said last week. It is the advice. Dr. Weekly, who spoke last week and is here again today, said something to me in a conversation that struck me, because I have been doing medical staff relations and the legal work for the medical staff for 30 years at Martin Health. That's how I started in the healthcare business. And she said, this is the first time I can ever remember all the doctors being in agreement on anything. And I thought back and said, she's absolutely right. In 30 years, I can't remember one issue that ever came up where we had unanimity. And it may not be unanimity, but out of 500, I bet I have 490 plus that would all say the same thing. We need to wear masks around others. We need to wear masks when we're in closed spaces. Even if we're outdoors and it's difficult to maintain social distancing, then we need to wear masks. That's not suggesting that we wear a mask all the time. I walk about 3 miles every night in an area where there's virtually no people and it's really easy to keep separate, and I don't wear a mask when I'm out there walking. But it is virtually universally agreed amongst physicians and particularly epidemiologists and infectious disease specialists that masks prevent the spread of this disease. Again, we need to socially distance. We started out emphasizing this, and I have made it a point to observe myself as well. There was a time when I was washing my hands thoroughly with soap and water, warm water, washing my hands for 20, 30 seconds. When we started this out, and I'm falling back into old habits, and I'm trying to do better. I'd ask everybody else to join in that with me. We need to go back. That's also the best way to prevent infections of all kinds. You want to prevent the flu, wash your hands all the time. In fact, that was the advice we gave to the community when we had the hepatitis A outbreak. Wash your hands. We do these things to protect ourselves. I have reflected on this in the last week and had multiple conversations, and it saddens me a little bit. When I was young, I was taught that in this country, you willingly sacrifice for the public good. That's what this country was built on. There was a sense of community and a willingness to do that. And to me, wearing a mask is such a minor sacrifice. If we go back and look at the sacrifices that paid in the history of this country, the things that were done in World War II and other times, as I recall, I'm reading some of Sandra Thurlow's books. There was a time we had to turn out, everybody that lived here had to turn out their lights at night because we were afraid of German submarines off the coast. Just wear a mask. It shouldn't be a big issue for most people. There may be a medical reason why, and if that, we should work with people. The failure to do these things means more people will be hospitalized. More people will test positive. And I would very respectfully submit to every member of this community, it means that this recovery will fail, or at a minimum, it will last, it'll take much longer for our businesses to recover. While we have opened it up, the economy right now is hampered by the fact that so many people are afraid to go out in public. There are those who are not, and they're getting infected, and then those that are and that are not getting infected, but they're staying at home and having it delivered to their house, I guess. So we continue to engage in the same precautions, extraordinary cleaning of our facilities, no evidence of transfer of the disease, still evidence of people not coming to the hospital when they should. Would please encourage them to do that. Any hospital, it should be any hospital anywhere in the country, but we are constantly and consistently disinfecting and cleaning. We cohort patients, so the COVID patients are kept on a floor. I've been asked multiple times this week after my presentation last week, are you out of rooms? No. I've been given tremendous resources at my disposal because of the Cleveland Clinic, and I can convert rooms and make more ICU beds. Not I can. First of all, I need to stop speaking in the first person. We have an incredible team of people that can do these things. But there are limits. I mean, we have a plan that goes in phases that ultimately has us taking medical office space and converting it to hospital beds. Can I do that? Yeah. It was going to be optimum care? No. And will it put some of my caregivers at more risk than they are today? Yes, and it is my job first and foremost to protect them. I mentioned last week that we're going to be out of step with the Cleveland Clinic on visitation. And I've received some negative feedback on that. And we're looking very hard at how we can open that up some and allow loved ones to visit or have a limited number of loved ones visit patients. We want that more than anybody. The last thing we want are our patients to feel sad and lonely, and we've asked our caregivers to try and fill in that gap for people, and they have. They have served not only as caregivers, but as pastors and loved ones, and listened to the trials and tribulations of these patients, and I'm so proud of them for doing that, but we want to open that up, so there'll be more to come on that. But everything we do to ensure the safety of our community. And when we see a chart like this, we just wonder what the next week looks like. What we've basically done since I was here last week, a week ago, those were where it sits up there in the high 40s. And now we're up into the high 50s. Where does it go? And I'll close with this. Commissioner Campy, I owe you a debt of gratitude. I understand last week in public comment there was a suggestion that I should stick to running my hospitals and not come down here and volunteer information. And I understand that concern, and I'm respectful of it. But it's important that I say what I think. First of all, I come here at your pleasure. And if I ever wear out my welcome, please let me know. But trying to be an asset and be of assistance in that process. But for our community, please know we're a private organization. We're a private, not-for-profit hospital system. Well, actually, we're a healthcare system. I want to make that point. We consider ourselves the healthcare system for this community, not just the hospital. And what that means to me is that we also have a duty to speak out publicly on public health issues when they come up. So 3 years ago, or whenever it was, when we had the horrible blue-green algae and we were posting signs in our emergency room saying, do you have respiratory problems? Have you come in contact with the Wind River? Please let us know. We held a big press conference out on the helipad behind the hospital, received a lot of publicity, and in fact, I was criticized at the time for the damage it might do to tourism. I personally don't think it was that way. The news was being covered on CNN and Fox and every place else. We didn't have a secret, but we were saying something had to be done. And on hepatitis A, we did the same thing, and today we're doing the same thing. And we see that as our social responsibility. And I'd point out to the community that it's not, if somebody says, well, you're doing this for business or to drum up business. We've done drive-through testing. I've seen my numbers on this. Our organization has spent well over $1 million doing drive-through testing in our facilities alone without getting paid a dime for it. That's a free service that we're not obligated to provide, and other hospitals in the region are not providing. The Cleveland Clinic has provided it because it was the right thing to do. And we'll continue to speak out on that, and I hope that people understand that. But that being said, we serve on the governor's task force on reopening the economy. My chief operating officer, to be clear, my title is, because there's been some confusion about that, my title is president. Chris Soska is the chief operating officer. Chris is serving on the school board committee, trying to help get the schools open. I'm available in any capacity. We are pro-business. No business has been hurt more than the hospital has. No one's lost any more locally than we have, I'll guarantee you. But we're proud to do it because it's the right thing to do, and we'll sort it out later, and I've told you before the support that I've had from our organization. I strongly encourage the Commission to take action that will protect the community. There'll be plenty of other people to comment, and my views have been made clear, and I won't belabor the point, but I would be honored to answer any questions that any of you have.
Any questions, Mr. Lord? Oh, thank you, sir.
Thank you.
Next, we have Carol Ann Batani from the Health Department.
Good morning, Commissioners. Thank you once again for the opportunity to provide you with an update today on our COVID-19 situation. So currently in Martin County, we have 1,324 positive cases and unfortunately I have to report 19 deaths. 40% of those cases are in the Indian Town area, and the other 40% are in the Stewart area as well, although that does not exempt the other areas here in this county. The positivity rate, as you've heard before, is 9.7%. It is important to note one thing, is that from last Friday, when I reported, to today, we've had more than 278 positive cases, which is close to a 30% increase. The other thing that concerns me, and I have to share this with you, is this morning before I came here, I saw another 80 positive cases on our list. Of course, my team will be verifying all of this, but that concerns us greatly. All of the information is on the Florida COVID-19 dashboard. As you know, it's going to take time and research to fully understand COVID-19. But what we do know is the virus is here and will continue to spread without preventive measures to stop it. This virus, once again, has no boundaries and does pose a serious health risk, including death for those who are 65 and older and those with chronic health conditions. As you know, the Department of Health's main mission is case identification and contact tracing. We are doing that 7 days a week and up into the wee hours of the night sometimes. And contact tracing really is essential to stop the spread because it provides our team with an opportunity to talk one-on-one with cases and their contacts and provide specific instructions on what people should do to prevent further transmission. We continue to work very closely with our community partners in Cleveland Clinic, monitoring our long-term care facilities to assure that they are following infectious control protocols and protecting our most vulnerable citizens. Testing, as you know, we are continuing to provide testing in various locations. Florida Community Health Center continues to offer drive-through COVID testing in Indiantown Monday through Friday. On Saturday, June 20th, the Florida Department of Health in Martin County will provide testing at the Boys and Girls Club in Indiantown from 8 to 11. And also this Saturday, June 20th, Florida Community Health Center will join with the NAACP to offer COVID-19 testing on the Martin Luther King Boulevard starting at 10, and our health department will be there in an effort to support and provide masks and prevention education. So in closing, I want to reinforce the message of prevention. As you know, we do not have a vaccine, so we must take preventive measures to protect ourselves, our families, our elderly, and the people who take care of us at the hospital. Everyone can take steps to prevent the spread of this virus, once again, through good hand washing, staying home when you're sick, social distancing, wearing a mask, and frequent cleaning of high-touch surfaces. It is essential that we recognize that all of us can do something to prevent the spread of this virus. Using a cloth face covering mask is an important step when used in conjunction with the other prevention actions that I mentioned and help prevent the spread of this virus and ultimately protect lives. I want to especially thank the community, the business partners, everyone that's assuring to use those prevention measures to help protect our community. I want to especially thank my health department staff, as I recognize as public health heroes, along with our hospital staff, to work to promote and protect the health for the residents of Martin County. So thank you. Do you have any questions?
Any questions for Carolyn? Thank you, ma'am.
Thank you.
Next up, we got not-profits. Ms. Carol Dietz, would you?
While she's coming up, I just need to let folks know that we've had an issue with our Zoom, so Mr. Merker will be restarting that. I just wanted everybody to be aware that that was a problem for us.
Good morning, everyone, and thank you for allowing me this opportunity to share what nonprofits are doing in our community. After listening to Rob and Carolyn, I'm thinking that people don't understand that nonprofits are a support mechanism for the work that they're doing. We continue to work together as agencies to make sure that the agencies that are opening up and trying to open up and go full board are using the CDC guidelines to keep the clientele safe. One of the problems we're having is any groups that have large groups of individuals, whether it be the Kane Center or our camps, they're having problems keeping the social distancing. They're doing it, but it is an area of concern to get back to full capacity. An update on food, which is something that I know you all are very interested in. Our food providers that are on the calls that we have weekly, we have a weekly call. The providers that are participating with us continue to tell us that there is plenty of food available, which is a good thing for our community, because if there are families that are home, there is enough resources for the food to be delivered to them, and we're working with the county to do all of this stuff. So that's important too. The Treasure Coast Food Bank has said that they have plenty of food for any agency that isn't currently registered with them to assist them. House of Hope is helping 15 different nonprofits in our community with food also, and both organizations are partnering with the dairy program providers. They have plenty of milk to go around. That's also very important for our families. I wanted to give you a quick update on masks. We have helped to secure 6,600. Our sewers have been sewing away, and we have some in our office. And to me, there's no reason that anyone that wants a mask doesn't have it. They can call us. We'll make sure they get it. Another update on the funding consortium. We've continued to award grants. 25 agencies have received grants of about $860,000. In addition, the United Way COVID's Fund has helped 94 families in our community with financial assistance. We've also provided dollars to help buy bulk food for some of our providers, and also helped support Meals on Wheels, because they've been really tapped with the delivery of meals to our seniors and the increase in demand, so we've provided a financial grant for that. And we also helped to purchase sanitation supplies for our camps. I also wanted to let you know something else that United Way is doing is we provide the administration for the Emergency Food and Shelter Grant Program, which is a federal program. And traditionally, we receive state set-aside funds of about $15,000 to $20,000 that we administer through the county. This year, we're getting the $20,000, but there's also a phase called Phase Cares, so we'll be receiving another $103,511 for agencies to help with rent and mortgage assistance and utilities for our community, which is really amazing for our community. We continue to track volunteer hours, specifically related to COVID, and to date, we've tracked $243,000 worth of volunteer hours that will help the county. Once again, I'd like to reiterate, if there are seniors that need help, please call our office. We have volunteers that are doing shopping. We have volunteers that have been delivering things, so it's amazing. I want to publicly apologize in advance. I won't be here for the 10:30 grant and aid process because I have to go do a Zoom meeting at 10 o'clock with our colleagues across the state. But I did want to let you know that I have an amazing staff member that will be here to talk about the Tools for Success program, and any consideration would be most appreciated to help our 9,000 elementary school children this year. Easiest numbers to call for assistance, 211, the county number 772-287-1652, or the United Way's number at 772-283-4800. Any questions for me?
Seeing none, thank you very much
Thank
for
you.
being here. Rob, Renary, did you have anything? No? You're good? You're not on the list. I was just giving you. You're on the list? Oh, you're in public comment. Okay, all right. Okay, that then brings us to our Emergency Management Director, Michelle Jones.
Good morning, Commissioners. Thank you again for the opportunity to provide an update. Emergency management has really taken a supportive role. As Carol mentioned, we are ready and able to provide resources and coordinate resources for any activities that do take place in the coming weeks. We continue to coordinate and collaborate with our nonprofits to ensure that they're meeting the needs of the community and that we're identifying any gaps in service and working with them to provide support for those individuals. The Community Information Center will close today at 5 p.m. Unless otherwise directed, so we have that in place. But that's emergency management in a nutshell right now. We are here to support and here to help. Any questions?
Any questions?
Great.
Seeing
Thank
none,
you.
thank you. Okay, that is the end of our presenters. So we will now move on to public comment. Go ahead.
Yes, sir. Prior to public comment, I would just like to remind everyone that we are currently in what we refer to as an election season. We do have county commissioner that is in an active campaign for reelection. Public comment is to address the Board of County Commissioners as a whole. We do not allow partisan politicking, which is defined as advocating the election or defeat of a particular candidate. Use of words, dates, signs, props, and/or wearing apparel or a nameplate that convey a message expressing advocacy for a person or a group of persons is also not allowed. Thank you for your cooperation, and you have 3 minutes.
Okay, we're going to begin with Carlette Peck. And on deck, we have Christine Shark.
Uh-oh. Taller people than me were talking. Anyhow, it's good morning, and it's lovely to see some of you again. For those who don't know, I was the former health officer for Martin County, thanks to that guy right there and a few other people. I had the pleasure of serving Martin County for 7 years. Currently, what you don't know about me is for 20 plus years, I was an epidemiologist. So you can understand why I'm very interested in Martin County and what is happening. Full disclosure, I was contacted by 3 or 4 health officers in the local area when this happened, asking me if I would work for them. Carol Ann was second, St. Lucie was first. So now I'm working for both St. Lucie and Martin County, and I'm looking at the data and giving advice based on literature and research and preparing statistics and situation reports for the health officers. So, what I have learned from the research is that there is a positive effect when people wear masks or a cloth face covering. That has been documented through research, most recently actually a controlled trial, so that it was demonstrated that masks do prevent transmission. In the beginning, it was a suggestion. There's a lot of misunderstanding, I think, about the purpose of the mask. The mask keeps your secretions off of other people. So, in a sense, when Rob said it's a public service to wear a mask, it is a public service because you're keeping your stuff, your aerosolized particles off of other people. And when they do that, they keep theirs off of you. So there's an effect that is substantially increased when everyone is wearing a mask. The most effective way of not transmitting COVID is social distancing. That's 6 feet away. That is the best method. Masks are a secondary method that even add further protection to humans when we wear this. I also want to speak about the data. Our governor has put out a plan about reopening. I'm sure that you are all aware of that plan. And there are criteria called the gating criteria. At this point, looking at Martin County data, we do not really meet any of those criteria.
Carlette, your 3 minutes are up.
Okay,
Thank you.
all right, thanks.
Okay, Christine Stark, followed by Rob. Neri.
Hello, I'm Dr. Stark. I work in all 4 of Martin EDs. I've been there for 7 years. I want to thank you for recognizing that the numbers here are increasing dramatically and that something needs to be done to protect our citizens of Martin County from the virus and in some cases from themselves. I wasn't here on Monday, but I did listen live, and I think it was Commissioner Chiampi that compared wearing a mask to wearing a seatbelt. Not everyone liked the seatbelt laws at first, but over time they became widely accepted because they saved lives. And I have a different analogy. In the 90s, states started banning smoking in workplaces, restaurants, stores, and other public areas. Why? Because breathing secondhand smoke is potentially dangerous. Smokers complained about it being a violation of their freedom, but now most states have smoking bans because they understand that the personal freedom of an individual ends when it becomes a risk to others. I feel the same can be said for wearing a mask at work, especially if you work by carrying a plate of food just inches from your face, or if you're cutting somebody's hair. If you don't have a mask on, you are potentially dangerous to others. You might wonder why I have all this on. This is pretty much what you will see all of the doctors and nurses wearing in the ER when they take care of patients. There's an N95 mask under here. 4 months ago, I would only wear one if I had a patient with TB or meningitis or some other dangerous disease. I would wear one per patient and then I would discard it. Now, since they're in short supply, I have to wear the same one for an entire shift, turn it in to be sterilized, and then wear it again. I wear this plastic shield, a plastic gown, something on my head, something on my feet, gloves for every patient because we don't know who has the virus and who doesn't. People say that we are heroes. You've got a sign up there thanking us, but really we're just people trying to do our jobs and stay safe. But the general public is making it harder and harder for us to stay safe. On a conference call yesterday, our CMO told us that Martin Health has 36 employees that have tested positive, and contact tracing showed that they contracted the virus out in the community. 17 of them are still out of work. It's easy for people to say that they support frontline workers, and by frontline workers, I don't just mean doctors and nurses, I mean housekeepers who clean the rooms of coronavirus patients, the bag boys at the grocery store, the cops, the paramedics, the post office workers, everybody. So for all of those frontline workers out there who don't have the luxury of staying home, and especially for those who wear all of this for 10 to 12 hours a day, I ask you to mandate that people wear a simple mask like this for the hour that they're at Target or while they're getting their nails done. And if they really can't be inconvenienced enough to wear a simple mask to protect us and to protect their neighbors, then they should stay home.
Thank you, ma'am. Mr. Ranieri, followed by Tara Wieben.
Morning, Commissioners. For the record, Rob Ranieri with House of Hope. Just a couple things that, as Carol from United Way mentioned, we do have plenty of food right now in Martin County. We're fortunate in that regard, but those resources are not unending. So the point that Mr. Lord made about masks and using that as an opportunity to improve our recovery, I think that would be well served. At some point, we will become resource challenged if we cannot shorten the length of the economic conditions that we're experiencing in the county. So I hope that in your discussions today, you'll take those points into consideration. Also, whatever you decide with masks, I hope that a big part of it will be include education. What we see, and this is anecdotal, I don't have stats on it, but what we see at House of Hope with many of our clients, they're trying to wear masks and they want to do the right thing. Not always are they wearing them properly or understanding the consistency that should be involved and the social distancing aspects that should be involved. And certainly for cloth masks, maintenance, washing them, cleaning them, and reusing them. So whatever we do, we should take those points into consideration and know that when we talk about education, it's wide-ranging. Not everybody's getting their information from the news or from MCTV, so every means possible to get good information out to every piece of the public will certainly be valuable as we continue to fight COVID. So thank you.
Thank you. And Tara, it's for grants and aids, so we're moving on to Sonia Pease.
Thank you. I'm here on behalf of Cleveland Clinic, Florida. I'm the Chief of Quality and Safety, and I represent a little over 10,000 caregivers here in the state of Florida. And, you know, as Dr. Stark and Rob have already, I won't go over all the details they've already said, but I can tell you one of my biggest fears right now is the fact that we do have, we've done a great job of protecting our caregivers in the hospital. We're not afraid of our caregivers getting COVID at work. I'm a frontline caregiver. I'm an anesthesiologist. I'm also a small business owner. My husband and I and my brother own businesses and operate them here in Martin County. Our caregivers are getting COVID through the community. And when a caregiver goes out or they've been directly exposed, that's 14 days that we can't have that caregiver in the hospital. And as those numbers climb, and as the numbers of hospitalizations climb, there's going to be a critical threshold where we are going to be at risk of being able to take care of the patients, that the community is, if the spread continues at the current rate. So I rise on behalf of our caregivers and ask that we implement universal masking.
Ann Rosenbaum. Jonathan Sloan.
Thank you. Good morning, Commissioners. I'm Dr. Rosenbaum. I'm a stroke neurologist from the Cleveland Clinic Martin Health System. I just wanted to add on to the numbers that Mr. Lord and Dr. Stark and the woman who was an epidemiologist mentioned and got up here. So overnight, Florida has had its largest number of cases since this started at 3,207. We are one of 4 states that are currently in a surge, including Texas and Arizona and California, right? So, and I was watching the news this morning, and of course it was just the news, it wasn't an epidemiologist, but apparently we're expected to potentially be at the epicenter of COVID in the next 2 weeks. The next thing I want to talk about is Hong Kong. You might wonder why, but I wanted to tell you a little bit about what happened in Hong Kong compared to Martin County and compared to Florida. Hong Kong has a population of 7.451 million people. They have had a total of 4 COVID deaths. 4. How did they do it? Well, let's compare to our numbers. Martin County has a population of 146,318 people. We have had 19 deaths. And then the Florida numbers are somewhat worse, a population of 21 million, and the deaths are at 3,061. So the state death rate is 3.56. That's almost 4 people out of every 100. That's a very high number. The death rate in Hong Kong is 0.05%. The reason why this happened was because in 2003, Hong Kong went through SARS-CoV-1. Since then, they've been obsessive about one thing, and that is mask wearing. These numbers are widely available. They're available at the CDC. If you just go online and Google Hong Kong death rate, every day Hopkins keeps a log of all the countries and all the states and how many people have died and how many people haven't. But I just thought that that would be a good comparison for us to have, to sort of show what can be done, just by simple mask wearing. Thanks very much.
Thank you. Jonathan Slolan. Maybe you can get your name correctly when you get up there.
That was pretty close. It's Jonathan Sloan. So I'm Jonathan Sloan. I'm a practicing anesthesiologist at the Cleveland Clinic, Martin Health System. And I think you've heard from our other clinicians and Mr. Lord the scientific evidence supporting us taking additional steps within our community. But I just want to speak personally that the 2 safest places that I feel right now is number 1 in my house, and number 2 is at the hospital. And the reasons for that is because obviously in my house, there's mutual respect. We clean the area, we don't have any other outside visitors, even family members, because people have this false notion that just because you know that person, that you're going to be safe, and the hospital. And why is that? Because I can't walk through the hospital without getting my temperature checked, without putting on a mask, and everything being clean there. And as you heard, and I think that this is probably one of the most important facts that you're going to hear today, is that our caregivers in our hospital are not contracting COVID because we're taking the proper precautions, and that includes wearing masks. But where are we getting infected? That's outside in the community. You guys have a chance to make a difference, and you guys should make a difference today. Because every day that you wait, we're already fighting behind the curve because it takes about 2 weeks before all this data that you saw today. And the transmission rate is not linear. It's not 1 for 1. It's exponential. So if we want to figure out how to live with this illness right now until we have a treatment for it, we need to act now. And right now, the best thing that you guys can do is implement mask wearing. Thank you.
John Neiman?
Actually, Commissioners, could we pause for just a moment? We're having some Zoom audio issues. I need to redial it.
Okay.
Is that okay?
All right.
Thank you.
Welcome to Zoom. Enter your meeting ID followed by pound. Enter your participant ID followed by pound. Otherwise, just press pound. Continue. Please enter the meeting password followed by pound. You are in the meeting now. There are 7 participants in the meeting. You are muted. You can mute or unmute yourself by pressing *6.
One more second.
You are unmuted.
Thank you.
Go ahead, sir.
Good morning. My name is John Nemi. I'm a local urologist here. I am on staff at Cleveland Clinic, but I am independent, not an employed position. I wanted to first say that thank you for your time and listening to us. And the facts that have been presented before me are spot on. A few key things that I think may help you in your decision making is I'm sure you're getting a lot of pushback from opponents of mask wearing who may say that they know when they're healthy or they know when they're sick and they know when they have to wear a mask. Unfortunately, the data shows us that a few important factors. 25% of patients with COVID do not have any symptoms. We also have a large proportion of patients who have only mild symptoms, who may kind of ignore it or minimize those symptoms. And there is the important fact that even those who get ill, there is a period of time, 3-4 days, where they are contagious before they show any symptoms. So someone in the community telling you that they know the best is difficult in this situation. As has been pointed out, we have lots of examples of sacrifices people have made in the past, and mask wearing is very, I think, very simple thing to do compared to what has been done in the past. We have other bans, like have been mentioned before. Smoking has been banned because we know that the effects on other people, which actually would show up much later in life, are going to be also there. I think this is important, that we want to avoid having to have a major shutdown like we've had. I think that would be quite devastating if our schools couldn't open in the fall, if our businesses have to close. This would be quite devastating. I've heard from teachers and students who say the online learning is quite difficult for both. The teachers have a very hard time developing the curriculum in that setting. The students say they get a lot more busy work and less instruction. We certainly don't want our businesses to shut down. So we need to find ways to mitigate this, the coronavirus effects. And the simplest way, the most beneficial way is to simply make mandatory mask wearing in public, a binding thing. So I hope that when you hear from opponents who say that this infringes on their rights, that you can use some of the examples that have been brought up today to know what is the best thing to do. Thank you.
Thank you. Robin Cass?
Hi, thank you for letting me speak. I am a resident of Stewart. I am a mother, I'm a citizen, and I'm a physician. And I wanted to add my voice to emphasize the message from the physicians in the community that you've heard. I think it is essential, even though you're hearing it again and again. Maybe we just need to say it that many times. And before I just read what I had prepared in my email, I just wanted to thank the health department, because I've also taken a course in contact tracing, and contact tracing is so important, and what they do is incredibly important, and I think we should emphasize and thank them, because if we can contact these people and isolate them, we can also shut down the spiraling out of control. And if we get numbers out of control, we're not going to be able to contact trace, and then it's really going to get out of control. So I just wanted to, I was here last week, and I've been working with Dr. Weekly, and I just wanted again implore you to come together today to make a decision and to make mandatory mask wearing for all workers and all citizens when in public, indoors, and when outdoors in close proximity to others. Not just workers. Obviously, when someone's eating, you'll have to remove a mask, but otherwise, people should be wearing them. I see so many people not wearing masks, like in the pharmacy or picking up takeout food, and they're very careless about it and don't care. This should be mandatory in conjunction with recommendations by the CDC that include standing 6 feet apart and good hand hygiene, as we've heard. The number of people in our county with COVID-19 is rapidly increasing, and something must be done. Masks are now mandatory in the Keys. They are mandatory in the state of California. They have been mandatory in other states like Massachusetts and Rhode Island and in New York. It can be done, and it must be done. A close friend of mine, a healthy middle-aged woman, just tested positive. And for anyone who thinks that it can't be transmitted asymptomatically, she got it from somebody who was asymptomatic who subsequently tested. So it can be transmitted asymptomatically, hence the importance of wearing masks. If you don't already have a family member or friend affected now, then you will soon. You cannot drop the ball here. There are many studies that show a decline in cases of mandatory mask wearing, and many of the physicians have mentioned them. If the number of cases continue to increase here in Martin, we will have a hospital bed, staff, PP issues eventually. And the health department will not be able to keep up and contact all the ill people to aid in isolation and quarantining. And the numbers will then increase and double even more rapidly. And it could spiral out of control if you do not act now. Now is the time to make the decision. Just like the Roosevelt Bridge needs to be closed out of an abundance of caution to protect the public, even though it's causing a lot of aggravation, masks need to be mandatory even if aggravating or inconvenient. Please look at how other counties and other states have accomplished this and do the right thing. Thank you.
Thank you. Mary Fields.
Hi, good morning. I actually wanted to speak in the last section about grants and aids.
Oh, I'm sorry.
So
Well,
I don't know if you want me to speak now or save it.
We can come back to you.
Okay, thank you. But I am a proponent of
It
wearing
does
masks.
say that, and I
Thank you.
apologize. That's my fault. Oops. Oh, again, we have Mr. Rob Lord.
Just very briefly, there's a group that, to me, seems to be underrepresented and has been this whole time, and I didn't realize it until I received this text message. And for the record, I'm speaking personally as a citizen now, not as the president of Cleveland Clinic. But we do have close to 1,000 volunteers, auxilians, senior citizens. I'm not seeing many 70 and 80-year-old people here. And that's probably because from the beginning we've told them to stay at home and avoid this. And if you looked at the charts that I saw you earlier, you saw those age groups were pretty low because they've done that. But they're not represented. But we have a volunteer board, and we have all these auxilians, all of whom have been sent home since the beginning and not been in the hospital. And one of them that is a friend sent me this message, and I just wanted to read this to you. Our caregivers and our elderly citizens are at the end of a bullwhip where very slight actions of the wrist can cause disastrous results. Today, we need the county commission to take decisive action. And I just wanted to give you that quote from a very distinguished and very bright citizen who I'm sure is reluctant to come to a meeting like this because of age. Thank you very much.
Thank you, Rob. My last speaker form for people in the room is Ms. Terry Pender, which...
I don't think they heard you, Harold.
What was the name? It was hard to hear.
Terry Pender.
I want to start by thanking Mr. Campy, Ms. Hurd, and Rob Lord. I'm swooned. I am a business owner. Together with my family, we own Pinter's Nursery out in Palm City. We pulled our first occupational license here in this county in 1975, but have vendor relationships in Florida that go back to 1960s when my husband's family had a nursery in the Bahamas. We're on our third generation and blessed to have the opportunity to have raised our children in this beautiful community. And when we decided to offer retail services, I chose the name, the Community Garden Center at Pinder's Nursery. And Mr. Smith, you were there. You helped us plant our champion Dahoon holly out.
See, we did plant that tree.
Yes, we did. We did.
People have forgotten that.
I have not.
Thank you.
So I don't know, I've been listening on my ride in here, I was listening, and I am, what a lot of people don't realize is that I'm also a nurse practitioner. I'm CDC certified as an infection control practitioner, and I provide consultative services in infection control to Water's Edge Nursing Home in Palm City. So I know a little something, something. And I'm going to tell you, as a business person, I have so much empathy for the leadership because as a business person, you are called to lead. And in this time, we have been the only ones trying to speak sanity here because there's not been any backup from leadership on any level. And you all know where you stand. I know you've got a lot of things. I have so much empathy. I've never had to make such difficult ethical decisions in my life. And the only thing that keeps me going is the fact that I am blessed to be doing it in a nursery that grows plants and not under Mr. Lord's program there. But almost after hearing this, I'd rather be on the front lines in Martin Health than where I am. On March 8th, we started drawing chalk lines. You'll remember the pandemic was declared on the 9th. But on March 8th, we started drawing 6-foot lines. And that began the assault of people. You're promulgating the impeachment. You're crazy. There's no virus. And we just said, sorry, owner's prerogative. We're asking you to distance. March 21st, we had to close because my employees abandoned ship. I have a lot of middle-aged, retired ladies who just want to come and be in the flowers. And they're like, I don't feel safe. People will not respect the 6-foot distance. We had to close. We did curbside. I had Carlette Peck, who was a personal friend from my days in public health, who came and looked at what we were doing, gave us tips. We've been keeping people safe. This whole time, every other garden center in the world was letting you shop like nothing was different. Our employees have suffered slings and arrows and insults, being called sheep, being spat at, being threatened with shutting us down.
Ma'am, your
Terry,
time's up.
your 3 minutes are up.
So all I got to say is when the experts tell us it's okay to drive on that bridge, are you going to believe them?
Ma'am, your time's up. Thank you.
They're telling us where I'm at.
Okay, that is my last speaker form, so we're going to send off to Mr. Stokas, which has quite a list of email public comment.
Yes, for those who don't want to listen to me, it might be a good time for a bathroom break. This first comment is from Elizabeth Sheldon. She writes, absolutely no mandatory masks. Masks are unhealthy and it is way too hot in Florida to force people to wear them. We are not communist China. We have plenty of hospital beds. This flu virus will be with us for a long time. We need to develop immunity, and adults have the right to decide for themselves how to live. Media is pushing their control agenda, and every official who stood silent, watching protesters and rioters doing whatever they want, now have no say over the rest of us. We are humans. You cannot tell us our every move. That was never You are mandated as commissioners. You were elected to manage county business, not people's personal business or way of life. Next comment, Kelly Ricardo. COVID-19 cases are surging in Martin County. The time for leadership is now. Consider your first mission the health and safety of your community. This makes the question of whether to mandate masks clear. Masks make everyone safer and will slow the spread. This meets your first priority. Everything else is secondary. Show the leadership we need. Now, vote to mandate masks. This is a health decision, not a political one. Next comment, Tanvir Chaudhry writes, as a concerned physician, it is imperative for the health of our community that mask wearing is enforced in Martin County. Our COVID-19 case numbers are currently skyrocketing and ICU bed availability is dwindling. Now is the time to act. We cannot stand by and watch these numbers increase daily with no change in local behaviors. I am very concerned about the health and resources of our beautiful community. Next comment is from Casey Darling Niffen. The percentage of positive tests in our county continues to increase, and public health experts have identified Florida as the next possible epicenter. Public health guidelines of mask wearing in public, and this makes life even more difficult for those who believe in the science. CDC guidelines and best practices for limiting transmission of the virus. I understand the current political landscape has made this a polarizing issue, but the scientific evidence stands on its own and should be the guidance rather than the party lines. There are communities, even countries, that are containing the spread of the virus by minimizing impacts to the economy and healthcare system, and they are doing it through mask wearing and physical distancing. I am asking that you mandate mask wearing in Martin County. Please help Martin County residents feel safe enough to support local businesses by encouraging our mutual safety through mask wearing. You do not need to read, oh, never mind, don't need to read that. Next comment from Susan King writes, to mandate citizens wear face masks is an infringement on our individual freedoms. If someone is in ill health or in fragile state of health or aged and they feel vulnerable, they may choose to wear a face mask. It is not my personal responsibility to have to be cautious of their health. They should remain home, have others shop for them, etc. I have a personal responsibility not to be out when I'm sick. That is a different story. Life is worth living, not existing. Safety, yes, but the loss of freedom, no. Take care of yourselves. It's not the government's job to do that. It's an individual's responsibility. Next comment. Kelly Carson writes, I do not support a mask requirement in the county. The numbers do not support it. People can make their own informed decisions about what is best for them and their families. Personally, no masks. Next comment. Catherine Cassandras. The information, she attaches an article, it's information from Monroe County. Hold on to your masks. She attaches a news story. I apologize. The next comment, Emma Caton. Hello, Board of Commissioners. As a resident of Martin County, I do not feel safe in my hometown because of other individuals' disregard for public health. Currently, the Martin County local government is failing us. The number of new COVID-19 cases continues to rise in Martin County, while restrictions continue to be lifted, exposing more individuals to this deadly virus. According to information posted on your Facebook page, 10% of all cases in Martin County are resulting in hospitalizations. This is unacceptable. The purpose of masks or face covering is not to protect the wearer, but to protect those around you. By mandating and enforcing that all individuals in Martin County wear face masks, you will be showing that you prioritize public health of your residents. Other areas in Florida, including Orange County, the city of Orlando, and the city of Tampa, have begun to mandate masks beginning this week. Martin County should be a leader in the Treasure Coast and mandate wearing masks in all businesses and public spaces. Next comment, Amy Smith. Research has shown that masks reduce the spread of COVID. Please make masks mandatory. We are running out of ICU beds. It's not going to get better on its own. Prioritize your citizens. Next comment. Lily Caton. I feel unsafe out in my community because I am unsafe going out in my community. There's a general disregard for public safety in the county, and that puts me and every other health-conscious person at risk. The numbers of infection and hospitalizations are clearly rising, and something must be done. I demand a mask requirement be made in Martin County. Next comment from Shauna Caton. In the interest of public safety, I'm urging the Board of County Commissioners to require the public wear face coverings in all public spaces. A strongly encouraged order is not what we need, and as a commissioner said at your last meeting, it's just a cop-out. According to CNN, Florida reported 3,207 additional coronavirus cases yesterday, which is the largest count since the beginning of the pandemic. Martin County is not an island. We are a part of a larger community that is sinking in infection. My hope is that the board will do what's right and what's in the interest of public health today. Tampa and Orange County have both issued mandatory mask orders. I hope Martin County will follow suit. Next comment, R.J. Pazzi. Just a reminder to our commissioners, you all committed to honor, protect, and adhere to the U.S. Constitution and our representatives via swearing an oath of office. You were not elected to ignore and restrict our pursuit of happiness, livelihoods, and individual choices. No, this is not just like seatbelts, nor is it about respect for others. It's about government overstep into our lives and freedom to choose. You commissioners answered us. The silent majority is watching, and your positions are not safe. Other county citizens are organizing recalls of their commissioners. Please save us all the time and money and do not vote for lockdowns, restrictions, or mandatory masks. Thank you. Next comment, Debbie Harris she writes, say no to masks. Next comment, Livia DeBonet. I write this as a mother, as the wife of a healthcare professional and a small business owner. We all have heard the alarming case of numbers that we are seeing both for Martin County and for the state of Florida. Yesterday, multiple news sources were reporting that Florida has the markings of the next coronavirus epicenter, and we all know the devastation that can come with that. Recent data indicates that the average age of the infected people in Martin County has been getting younger. This may seem like good news at first, since we know younger people are less likely of dying of this disease. However, I do remind you that if there is one thing that kids and young adults are good at, it is spreading germs. I'm sure you've all heard of the Jacksonville bar incident in the news this week. According to the Florida Department of Health, as of June 12th, we've had 127 pediatric COVID cases in Martin County. That is about 10 times the number of pediatric cases of Indian River County and 3 times the amount of pediatric cases in St. Lucie County. We have the 3rd highest positivity rate among kids in the state and 3 times the rate of infection in children, adjusted for population of Miami-Dade County. While this age metrics has kept our death rate somewhat low temporarily, it will eventually spill over to our older adult population, and the consequences of that can be catastrophic. The time to do something is now. We need to make masks mandatory. It will take at least 2 weeks to see the results of any measures we take. As of yesterday, we have 21 ICU beds available in Martin County with 300 new cases every week and a 10% hospitalization rate. We will be seeing 30 new hospitalizations per week. If half of those patients end up needing an ICU bed, we could run out of ICU beds in a little over a week. The time to strongly recommend masks was back in May 4th when we started reopening, not now. Now is the time to require that everyone in public wear a mask at all times for everyone's safety. Tampa did it, Florida Keys did it, the whole state of California did it. We're counting on you on what's right for our beautiful community. Next comment. From Victoria Waldbauer. Please make it mandatory that all restaurants, retail establishments, employees have to wear face masks. Furthermore, make it mandatory that clients going to such establishments be required to wear face masks as well. Next comment is from Alma Reyes, Dr. Alma Reyes. I'm a local resident physician and ask that you make mask making mandatory in all public areas, particularly closed areas, in order to protect the local residents and medical professionals. The data is clear that masks reduce virus transmission. Please help our local hospital caregivers healthy so that we can take care of you when you are sick and you need us. Next comment. Andrew Caton writes, I empathetically request the Commissioner show responsible leadership to protect people of Martin County and pass measures that will save lives. Mandating the use of masks indoor and public outdoors if you can't have 6-foot distance. San Francisco has exactly that, and only 45 COVID-19 deaths in a population of nearly 1 million. Thank you. Next comment, Rosemary Metal. I will not go to a restaurant or a busy OTHA. This does not have employees wearing masks. Until it is mandated, many businesses refuse. Our economy will do better if they are required in addition to the health benefits. Next comment, Ruel Strassel. Dr. Strassel is a maternal fetal medicine specialist with over 20 years experience. He relocated to Florida in 1997, has since made caring for high-risk pregnancy population his passion. He is the only maternal fetal medicine specialist serving the Florida area from West Palm Beach to Melbourne. Since Dr. Strassel specializes in high-risk obstetrics, along with regular OBGYN, it provides patients with access to complete quality care. Potential issues are identified a lot faster with your average OBGYN practice. We see a lot of patients that exhibit hypertension, diabetes, autoimmune disorders, blood disorders, including COVID-19, and an array of conditions that endanger the well-being of mother, fetus, dyad. Our goal is to provide quality managed care to improve health outcomes for pregnancies and infants. In 2019, our office completed 547 patient visits serving underserved patient population in Martin County. These include patients from the following zip codes: 33438, 33455, 33458, 33469, 33478, 34956, 34957, 34974, 34994, 34996, and 34997. The current birth rate in Martin County is 6%. 14% of the childbearing population are advanced maternal age, making them high risk. 5% are teen pregnancies. 44% consist of unwed births. The Health Start voucher program with the Office of Russell T. Stossel, MD, would allow access to high-risk specialized care that would otherwise be available for patients in West Palm Beach when referred to these areas. Despite requiring very needed care, never show up due to distance, transportation issues, respectfully request to consider this a very valuable and needed program and allow patients to receive quality managed care into local access. Next comment. Wendy Benoit. Please mandate that masks need to be worn in public. It is a known way to help spread COVID-19. We don't want to close all the stores, restaurants, and child care centers. Please listen to your medical experts and keep the residents of Martin County healthy. Next comment, Patricia Pike. I would like to ask for mandatory use of masks in public places and businesses. Thank you. Next comment. Is from Tiffany Nylander. Masks should be required by everyone in public spaces, especially inside. Next comment, Jackie Shannon. I believe that masks and social distancing should be required in our county. By wearing a mask, we can prevent the potential spread of virus. Wearing a mask and social distancing are minor sacrifices that we can make for the safety of our community as a whole. Next comment, Joe Smith. I think it's up to the person to wear a mask. Also, it would be fine to close down the restaurants, bars that are not following protocol. It would help the rest of the businesses that are taking the precautions that shouldn't get punished. Do your job. Make sure the sailors, twisted tuna, spirits, bonefish, etc., following guidelines, or close them down. Next comment, Barrett Fitzpatrick. As a permanent resident of Stewart with a compromised husband, I feel Martin County should make the wearing of masks mandatory in all establishments. Since opening, we are getting visitors from the other areas in Florida who come in groups, do not social distance, and do not wear masks in town or in stores and shops. Our landscapers and workers should all be mandated to distancing and wearing masks. Clearly and unfortunately, the county is not supporting the health, welfare, and safety of its permanent residents and citizens by not mandating and monitoring these activities. Please make masks mandatory. Next comment, Colin Matheny. The current practices around Martin County and the Treasure Coast are extremely dangerous and unsafe. At this current moment, many essential workers are not required or not to wear a mask or practice social distancing when working daily. It's especially concerning when there are many businesses, restaurants enforcing the occupancy rules and the no mask, no entry rule, in which barely any business hold up to this. Without some serious measures in place, we will continue to see deadly spike in coronavirus and looming threat of the public health. I hope you will consider changing the current regulations. Thank you. Next comment, Luis Bilecki. Requiring masks for workers who serve the public. She writes, I am in support of requiring the enforcing mask usage for workers who serve the public. Such measures are necessary to ensure the health of the public, especially the coronavirus cases rising in Martin County. Next comment, Allison Sweeney. I am asking that you make a requirement for everyone to wear a mask when entering the public building. Many people are not wearing masks and the positive cases have risen dramatically. Next comment, Sandra Grisham. Please require wearing a mask. It greatly reduces the spread of the novel coronavirus. At work retail, many people say they are not worried. I will beat it. I let them know I will probably be fine too, but if I bring it home, good chance my husband won't survive. I don't have an option to stay home. I have to support our home and medical insurance. Next comment is from Dr. Robert Hess. Martin County Commissioners, as you might have noticed, the COVID-19 case rate, that is the number of the cases beyond those attributable to an increasing testing, is severely rising in Martin County. I believe this is due to poor regulations by county commissioners. For example, allowing strangers to ride together in golf carts, as well as relaxing over other past restrictions that will sicken and kill more Martin County residents. I would appreciate if you could all get back to me with the thinking behind your legal but immoral decisions, which I believe are based on money and politics. Because of my past employment, I have a huge social media presence. You too will have my audience. At this point, anything you'd like to say or not say will be reported on Nextdoor, Facebook, Twitter, Instagram, Reddit, and LinkedIn. I appreciate your feedback, but not your silence. I will help you connect with your voters by reporting your votes and when you are not present at all to vote on these critical issues. Please be responsible and responsive and reimpose responsible social distancing and masks to save the lives of our fellow citizens. Thank you in this manner. Next comment, Robert Buckley. Much of the health department data of COVID-19 cases in Martin County is cumulative in it that it shows the total number of cases recorded since the beginning of the pandemic. Given that most or at least many people get over the infection in 2 to 3 weeks, is it possible to have the health department give an estimate of how many current infectious individuals we may have? For example, the state dashboard has a color-coded map by zip code. At 300 total cases given zip code is shown as red, the highest condition, the same in heavily populated locales or lightly populated. In other words, it is not the number of cases per thousand population. 300 cases in a zip code with 40,000 residents is much less of an issue in a zip code with 5,000. At some point, given that it is based on cumulative cases, every zip code is going to go red, making the data much less meaningful. Thanks for all that you're doing for Martin County. It is much appreciated. Next comment, Nancy Trudell. County Commissioners in the Keys passed an ordinance today requiring everyone to wear masks in public places effective immediately. They clearly understand the urgency of the situation we are in. I am pleading with all of you to make a big move at Friday's meeting and vote unanimously to make wearing masks mandatory in Martin County. Research and studies have shown that requiring the use of face masks in public is helping mitigate COVID-19 spread. Please take a look at the states that have mandated wearing masks in public and look at their numbers. We are the hot spot, and their coronavirus infection numbers are trending downward. Medical personnel are pleading with us about the importance of wearing masks, yet some are not heeding their advice and ignoring their pleas. We cannot continue to bury our heads in the sand and hope this goes away.
Mr. Stokas,
Yes,
could you please slow down just a little bit? I'm having a hard time understanding this.
Okay. This is not over by a long shot. We cannot ignore science and scientists. You ask these medical and health professionals to speak at meetings. You tell them how respected they are and how much you value them. You admit the dangerous trend we are heading towards with increasing hospitalizations and decreasing ICU bed availability. Yet you turn around and ignore their pleas and cannot unanimously vote on any easy way to try and combat this pandemic. By the simple act of mandating wearing masks in public, how hard is it for us in Martin County to do the right thing? What does this say about us? We are better than this. Not everyone will be happy with this decision, but that is the same with every vote and decision you make. Restaurants and businesses should respect their patrons, and patrons in turn respect them, with everyone doing their part by wearing masks and doing all we can to help prevent this from further spreading. In fact, this could actually increase businesses if patrons were more confident knowing they were following proper safety protocols. Please do not postpone this vote any further. The time is now. We cannot keep waiting days or weeks until the next meeting to make these difficult choices. Our health and our lives are too important to appease those who have had the opportunity to take this pandemic seriously but have not. We were lax in many areas sometimes people need to get proper guidance and rules and what is required to do safely. Thanks for reading, and thanks for all that you do to keep Martin County residents and Martin County safe in these tough times. I'm sure it can't be easy. The residents of Martin County are relying on you to help keep us safe and make the right choices on our behalf. We deserve to be safe, and we are at your mercy now. These are unprecedented times, uncharted waters, and we have no rule book. We cannot go back to this moment and do it over. It will be too late for some. This is a huge responsibility with huge ramifications. Please vote responsibly on Friday. The life you could save could be yours, mine, our families, our friends, our neighbors, the young and the old. Martin together, planning for recovery. Let's do this. This is an important and necessary step in the plan if we want to move forward in recovery. Next comment. Ellen Lambiaz. I strongly believe we phased in our openings too early. There are a large number of elderly here in my area, and people are disregarding suggested safety precautions, feeling above it all. Therefore, I think in the name of protecting the majority from the lax attitude of the minority, the wearing of face masks at the very least should be mandatory. Next comment, Jean Vickers. As a physician in this community, I want to strongly urge you to support mandating masks in our community. With the rapid increase in cases from our community spread leading to an increased admission in our hospital, we are on a dangerous path. It is important that our community hears firmly from its community leaders and its healthcare leaders that masking makes a difference. We also need to support our businesses that also want masking by making it the standard. We can take care of the sick, but we need to lead the well, and that means making tough decisions to support masking. Next comment, Michelle Taylor. As a Martin County resident, I support mandatory face coverings in public. I am a pulmonary nurse practitioner at Cleveland Clinic, Martin Health, and every day see firsthand the devastating effects of COVID-19 can have on people. I am alarmed at the increase in hospitalizations in Martin and St. Lucie counties resulting from community spread of the virus, often contracted from asymptomatic, pre-symptomatic people. Next comment from Stephen Shaw. As a Martin County resident, I feel strongly that employees of any business that serves the public should be mandated to wear masks while working. With the number of positive cases and deaths caused by COVID-19 virus, which is on the rise again, I do not see how there can be any other ruling. I repeatedly hear concerns about violating the constitutional rights of individuals by mandating they wear a face covering in some areas. I reject this argument. Laws in this country are written almost entirely to safeguard the rights and safety of all individuals against potential harm. Are we worried about violating constitutional rights by prohibiting speeding or drunk driving? Sounds absurd, doesn't it? And why? Because not making these acts illegal would put the public in danger. That is precisely what the issue is at hand. The WHO, CDC, and other public health officials, including those in Florida, have gone on record saying that people wearing masks will reduce the risk of contracting the virus by lessening or even preventing the spray of germs into the air. Why is it that government boards routinely disregard advice, knowledge, and experience of experts in the field when debating a decision that is for the public good, but is bound to be unpopular with some? These are not opinions that laymen should try to interpret or flat out disagree with. With all due respect, a decision to strongly urge wearing a face covering is making no decision at all. It only allows you to go on the record as saying your opinion is that it's a good idea. Watching what counties around us are doing and tallying their numbers for comparison is pointless. What matters is that what you decide to do in Martin County will be the safest option for your residents. If you are worried about overburdening the police, their job is to protect the safety and well-being of the public. It may not be popular with some citizens or even some of the police, but the officers knew what would be the case coming into their job. The problem for police comes when they are tasked with enforcing a vague, broadly interpreted mandate that may or may not be seen to apply to the situation they respond to. The preferred police action could be a summons, civilized citation, or warning, with arrest being the last resort. I speak on that issue from experience as a retired police officer of 35 years, the last 12 years of my career as a chief of police in Massachusetts. The overwhelming argument against mandated wearing of face coverings when you drill down to it is I just don't want to. The overwhelming argument in favor is I don't want to contract the virus, spread it to loved ones or others, and possibly die. I agree with the proposed amendment for businesses to post signs. It's hard to plead ignorance when the message was right in front of you, black and white. I would go a step further. Instead of a sign on a business announcing our employees don't wear masks, don't enter if you don't agree with that, why not have the sign state, okay. Next comment. Catherine Sketrapatic. As a community, we need to respond as one to the COVID-19 pandemic by supporting the emergency order to mandate face coverings. The safety of the collective whole is only achieved by agreeing as one to support the rules of that safe community. Businesses have decided reopening in support of economic recovery. They should be required to provide safe environments and consumers who would like to support their recovery. Visually seeing a business staff wearing protective face coverings tells me they care about their consumers' safety and about the community. Next comment, Alice Windley. Please make it mandatory to wear face coverings when public or in a store. We continue to see cases grow. This is not a joke. Sure, they have rights, but those of us at risk have a right to be safe. We have to wear a seatbelt, be licensed to drive, and many other things. Make this the same. Thank you. Next comment, Rory Raming. Please make face coverings mandatory in public spaces. Thanks in advance for taking the necessary action to protect residents. Next comment, Teresa Lewis. Please make it mandatory for wearing of face masks. Obviously, the governor wants to stick his head in the sand and doesn't want to admit the virus is growing out of control in Florida. Repeat comment. Next comment, Mike Siarkas. I urge the Board of County Commissioners to strongly suggest, but not mandate, the use of face coverings in Martin County. To date, Alachua and Seminole counties have brought forward mask-wearing mandates and have subsequently had to rescind these directives after facing legal challenge by residents. Just yesterday, a legal challenge has been filed against Miami-Dade County, and another has been announced being drafted for Orange County. In this time of great challenge, it is a misuse of time and funds to risk a lawsuit when we can better utilize those dollars for PPE, testing, and training, especially when the use of masks has been such a dividing topic amongst many qualified organizations on the matter. Thank you. Next comment, Todd Mazingo. He writes, no masks. Christina Lovero Acevedo. I am writing to implore you that masks mandatory now. Not tomorrow, not next week. Please let's not put this off any longer. What more scientific proof do we need to have in order to pass this regulation? There is no denying the fact that our numbers are consistently going up and up and up. As a Martin County resident, mother of school-aged child, and small business owner, I feel it is my duty to protect my son, my elderly mom, my family, my community, and my livelihood by wearing a mask whenever I am in public where I may cross paths with others. Why is this so hard for others to do? I don't get it. It may be an inconvenience, uncomfortable, and hot, but I'll tell you what is worse. Dying is worse. Dying alone is worse. Being sick for weeks is worse. Not being able to breathe is worse. Losing a parent is worse. Having a sick child is worse. Not being able to work is worse. My list can go on, but I think you get the point. Continued inaction is unacceptable. Restaurant workers should be made to wear masks, and so should anyone in public indoor spaces. That is what is required in states where the virus is under control. All you have to do is go to Publix, get takeout pizza or take a ride downtown to see that it is not happening here. Pass it today to make masks mandatory. Thank you for your time and consideration. Next comment, Tim Southington. Please, no mandatory masks. I have a medical condition where I cannot wear them, forcing me to carry papers to validate this reminds me of Nazi Germany. Strongly encourage them if you like them, but please no mandatory so I don't feel completely ostracized and judged everywhere I go. Thanks. Next comment, Thomas Shakers. Do not approve of any mandatory masks. The media hypes up this nonsense and there is no research besides the opinions of a for-profit hospital and the employees and doctors of that hospital. Get a third party to do a research study and I will consider it. But there is no proof they do anything besides take away my freedom while giving people false sense of security. Next comment, Sherry Baker. Please don't cave like every liberal county in the country and make masks mandatory. You get the doom and gloom report from the lawyer from the hospital every week that incites fear in everyone. Look around you. Are people dying in the streets? No. Our county watches too much CNN and needs to wake up and realize that positive cases are okay to build up our herd immunity and stop living in fear with the terrible idea of wearing masks. Next comment, Dean Forster. What is this terrible idea to put a sign in front of a business that is already struggling to make it in your county? Do not require masks in Martin County. Do not further burden businesses with government overreach. Find other ways to make your community safer without the use of coercion and threats. Next comment, Angel Gutierrez. As a small business owner in Martin County, it has been a rough year. First, COVID forced us to close, then rioters forced us to close. Now the bridge closing cuts off a ton of our customers from getting to us. Small business owners are working so hard to stay afloat. We are not the ones spreading the virus. Stop targeting us with these ridiculous mask requirements that will limit our customers even more. Thanks. Next comment, Robert Shaw. No mandatory masks. Next comment, Jennifer Nolan. Constant mask wearing has been proven to be both ineffective and unsafe. People wear them on their chin, and this causes cross-contamination. The average person touches their face 23 more times per day while wearing one. Forcing people to wear masks makes us breathe in our own toxins and CO2. It lowers our oxygen levels and our immune system. Masks are great when worn by trained medical professionals. They're not so great when worn by the public. I have seen people hang them on the rearview mirrors and use the same face mask without washing it for days and weeks at a time. This offers no protection. In fact, it makes the germ problem worse. Forcing constituents to wear a mask is a form of control to cover up the anxiety. Nothing more. We are adults. Please work to preserve civil liberties, our bodily autonomy, and our freedom of choice. Masks can be recommended but never mandated. I will personally boycott any business that requires paying customers to wear a mask. I encourage others to do the same. We are not a communist state. Fight for freedom of choice. Thank you for your time. Next comment, Stephanie Sommers. On June 10th, the U.S. Department of Labor's Occupational and Safety and Health Administration published a series of frequently asked questions and answers regarding the use of masks in the workplace. The information says both the cloth and surgical masks will not protect the wearer against airborne, transmissible infectious agents due to its loose fit and lack of seal or inadequate filtration. Further, OSHA does not consider cloth masks PPE. And she provides the hyperlink. On May 29th, the World Health Organization announced that masks should only be worn by healthy people if they are taking care of someone infected with COVID-19. If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a mask. Dr. April Baller, a public health specialist for the WHO, said in a video with the World Health Body's website, masks should only be used by healthcare workers, caretakers, or people who are sick with symptoms of fever and cough. Next comment, Leanne Fries. Dear ladies and gentlemen of the Martin County BOCC, we would like to thank you for your service to our community and for your receptivity to our citizens' opinions and ideas on wearing masks in Martin County. The wearing of masks has become a top-down, one-size-fits-all approach and is not appropriate for healthy people. In fact, We think there is an argument to me that the masking of healthy people does much more harm than good. All in all, it's vital to allow the citizens of Martin County to choose what they think is best for themselves and their family, without pronouncing shame or condemnation towards those that may not agree. We understand that there is a large amount of pressure on you, the board, during this viral outbreak, which has actually been far less harmful than originally predicted by many medical and government experts. You all have a tremendous amount of responsibility, and these issues must be approached with logic, common sense, and reasonable policy, rather than on emotion, innuendo, rumors, and fears of liability. Please empower the citizens with sound knowledge, logic, and sensibility, and give them the power to choose what is best for themselves and their family. Please vote no to mandatory mask wearing in Martin County. Thank you. Next comment. Frank Fender. As the mayor of town of Sewell's Point, I watch the data and science of our current public health crisis closely. The latest surge in Martin County infections is significant and concerning. Cleveland Clinic's Rob Lord's astute guidance on Friday, June 12th, to this county commission is illuminating and should be heeded. As community leaders, we work diligently to strike the delicate balance between public and economic safety. Stating strong policy on the usage of public cloth face coverings, face masks, to dampen spread, especially in places of business, is the least we can do as leaders to offer responsible guidance to the public. I am in favor of the county commission initiating strong policy directives in the use of public facial coverings as one aspect of working towards our zero infection rate of less than 1. Next comment, Christine Henderson. No to mandatory face masks. Next comment, Chad Granise. Good morning. I would just like to say that I strongly urge all of you to please vote to make masks mandatory. This virus is getting out of hand very quickly and will continue to do so until more strict preventative measures are not taken. Strongly urging the community to wear masks isn't going to do anything. You must make it mandatory. Thank you. Next comment, Tony Beaumont. You can't make the world safe for your kids. You can't make the kids safe for the world. If masks are not worn correctly, their usefulness is limited at best. Anyone with a compromised immune system would be a fool to think they are safe because others are wearing masks, but unfortunately that would be the case. Unless you're going to mandate that masks are properly fitted and require training on how to use them, this is a waste of time. If you want to save lives from the flu, your efforts would be better spent teaching people how to protect themselves. If you want to save more lives, focus on the drug problems in our community. Christine Bastidas. Please do not succumb to the pressures the media has created over shaming for not wearing masks. There is not proof they even work to protect the virus. If you can't guarantee my health won't be compromised from wearing a mask all day, then you shouldn't force it on me and others. Let's keep with allowing citizens to decide for themselves how to take care of their health. Next comment, Meredith Lee. Good morning. Martin County has approximately 161,000 people in it. Out of the total, as of this morning, we've had 19 deaths. Martin County is not a hotspot for COVID, nor does it show the indications that it will be. Mandating masks in public is the wrong decision, especially at this stage in the game. It seems that as if it would be an expression of control and not for our greater good. I did not move to Martin County for this type of environment. Many people physically cannot wear masks for many reasons, such as asthma, PTSD, etc. How will you force people with medical conditions to wear masks? How would you police this? Will you force masks on children because that is ridiculous and they will do way more than good, harm, I'm guessing, than good. Many times the Surgeon General, who, and even Fauci himself, have said these masks do little to nothing for the spread of the virus and healthy people should not be wearing them. There is data and studies that support this. Please vote no and do not mandate masks. The people of Martin County are watching and taking notes. Thank you. Next comment, Beckett Dawson. I'm writing on behalf of mask use in Martin County. I love our town and area and have been appalled at the lack of mask use in the area. We have been following CDC guidelines as best we can, as well as staying informed on the latest research-based evidence coming out on this topic. We should be following fact-based information from those who have spent their lives researching this very thing. COVID doesn't care about your opinions or political affiliation. This is a human matter that literally impacts every single person. We are the guinea pigs for the evolving situation that we'll eventually look back on. As a speech-language pathologist, our field has been researching the effects of COVID on eating, cognition, voice and hearing. There is significant proof of the lasting effects in all of these areas. COVID is affecting their brain and the ability to think and function, their ability to eat without aspirating, and they are being discharged from the hospital with lasting voice issues due to vocal cord damage from being intubated. Preliminary findings are showing that even those who are positive and asymptomatic have hearing cell loss in their ears. This could mean that hearing is impaired for those who are positive. It don't even know they have it. This could mean that hearing is impaired for those who are positive. The very least we can do is based on what we know right now. And that includes the fact that masks are not foolproof but can and will offer protection when the majority participates. The individuals working in the field at Cleveland Clinic are witnessing the effects firsthand and are begging you to do something. I am too. Please take a stand. Please require mask use in the area. Please do your part to help keep our community safe. Next comment. Cara Giuliani. We will not support or comply with mask mandates. We support medical freedom. We take precautions and wash our hands. Stop the madness and fear-mongering. Next comment. Elizabeth Sheldon. Absolutely no mandatory masks. Masks are unhealthy, and it was way too hot in Florida to force people to wear them. We are not communist China yet. We have had plenty of hospital beds. This flu virus will be with us for a long time. We need to develop immunity, and adults have the right to decide for themselves how to live. Media is pushing their control agenda, and every official who stood silent watching protesters and rioters doing whatever they want now have no say over the rest of us. We are humans. You cannot tell us every move. That was never your mandate, commissioners. You were elected to manage county business, not people's personal business or way of life. Didn't we already hear from this one? Is it a repeat? Okay. Okay, next comment, Jackass. I am commencing on my desire to make masks mandatory, at the very least for workers in our county, although mandatory for all patrons at grocery stores as well would be beneficial as a healthy next step. Not only have masks been shown to drastically reduce the spread of infection rates, but they are beginning to be adopted across Florida, including Tampa, Orlando, the Keys, and likely even Palm Beach County soon. If masks are made mandatory in Palm Beach County, many of those who wish not to wear them will come here to infect our workers, who will then spread it to anyone they come in contact with. In addition, cases are still increasing drastically in our county, with no sign of slowing down. Additionally, as these cases you see now are likely infected from almost a week now, 5 days symptoms, 2 days to take the test and get the results. The cases have increased considerably more since no one is wearing a mask. A recommendation is good, but no one listens. A mandatory order is far more beneficial. Myself and at least 250 of my personal colleagues are refusing to vote for anyone who does not make mask wearing mandatory, as this is a very serious public safety issue. Please vote responsibly on this order and the future one making masks mandatory across the county that will inevitably come as more cases spread. Thank you. Next, I know. I keep rolling in. Next comment, Mary Molina. Please make it mandatory to wear a mask. So many states have made it mandatory, and have reduced COVID rates. Next comment, Mark Jones. People should make conscious decisions about their safety and the safety of others, and should not be mandated by government in this case. Data presented by CDC, WHO has been changing to drive a narrative while hiding behind their view of science, which has been questionable. Leave the citizens to make conscious decisions of their personal circumstances. Next comment.
George, could you pause for a minute? Mr. Campy.
Mr. Stokas, are you reading emails that are coming in right now? Yeah, I think we need to have, like, when the meeting starts at 9 o'clock, that's where you have to, because people that are watching could continue to just send email after email and hijack the meeting, which sounds like we're heading in that direction.
Yeah.
Plus, I believe some of the emails that I had seen come into my email, I guess to all of us, were emails to commissioners, not necessarily emails to be read at the commission meeting. They go into a certain portal.
Yes, these have a certain
Okay,
portal.
so with that in mind, I still believe then we have to have, and maybe we can't do it today because we didn't have the policy in place, but I would recommend we make a policy that once the meeting actually starts, we're not doing real-time email comments. I think we could potentially have the meeting be hijacked and be here all day. It's already 11 o'clock. We've had 2 hours of public comment. I know many other public meetings limit a certain time of start and finish. I'm not saying we're doing that. I'm just saying he could get another 50 emails and we'll be here the rest of the day.
Well, you have the same issue with Zoom. I mean, people can Zoom in, and so would you like for us to look at the, if you're not on by 9 o'clock?
No, because that's public participation. Mr. Merker, how many people do you have on Zoom currently?
There are currently 4 people on
4.
Zoom.
I'll take my chances. Thank you.
In Indiantown, Ms. Krista, in Indiantown, they have, and I don't remember exactly what it is, but they have a cutoff for it's actually earlier because they have it in the evenings, they have it earlier in the day. You have to have your email comments or your comments in by a certain time, I think.
And I'm not
It's been a while
saying
since
that
they
the
talked
issue is,
about it, so I'm
Mr.
trying
Chair,
to-
I'm not saying it's for or against. I'm not trying to stop people on one side of an issue, but it eventually got to stop.
Yes, sir.
Can we take this up separately and just get through
Yeah.
this? And
George, how many more do you have?
3.
Okay.
Keep going.
Let's go.
Next comment, Zach Teller. I will not be wearing a mask, nor will I submit myself or my family or friends to be contact traced. I will also be publicly celebrating the 4th of July in downtown Stewart in remembrance of the freedoms we were born with and fight to protect as I have every year since I was a kid. This celebration is more important now than ever. The double standards put forth from government and health officials who financially benefit from the crisis are not hidden from the public. The public is disgusted by this nonsense and fear-mongering. Stop hiding behind your mask and get on with your lives and go give someone a hug. Next comment, Michelle Cohen. Please make the use of mask mandatory in all public spaces. Next comment, Rebecca McPhee. Please seriously consider making masks mandatory for all employees at local businesses and suggest that businesses make them necessary for their patrons. We're going through an unnecessary surge in cases in Martin County and across the state because too many people don't believe in the seriousness of this epidemic or that masks and social distancing work. Martin County has a large population of older citizens whose health is at risk, and we will not feel safe going out and patronizing local businesses. If these proven measures are not put in place, Monroe County has had the courage and wisdom to do this. If the Keys can do this, so can we. Please let's be a leader in fighting this pandemic and not just a victim to peer pressure and greed. Thank you. That, Mr. Chair, is all the public comment I have.
Okay, Mr. Merker, we're 25 minutes past our break, but it's your turn.
Well, it's the Zoom speakers' turn. I'm going to roll call them and ask the Zoom speakers to speak slowly and clearly, please. Mr. Taylor, you've been waiting patiently.
Thank you very much. Am I on?
You are.
Good morning, commissioners and speakers. My name is Ron Taylor, resident of Martin County since 1975. They say we are all in this together. That is true. It's time that we take this seriously, and everybody that enters a building in Martin County wear a mask, a protective covering, inside a building, whether it be an employee or a patron. The CDC and the professionals from Cleveland Clinic have expressed that position, and I agree with that. Nurses have expressed that position. There is no social distancing taking place in stores such as Publix. The other day, me and my wife went to the store, followed the one-way streets, maintained our social spacing. We both had masks on. There was a gentleman in front of us about 7 or 8 feet, no problem. He was going he was following the rules correctly, but he had no mask on. All of a sudden, he did a 180, turned around, faced us, and I said, whoa. His immediate comment to me was, what are you going to do about it? Commissioners, we need to do something about that. We need to put everybody out of risk. They don't have a right to enter the store with whatever they're carrying and put others at risk. It's not inconvenience. It's not political. It's science. I really respect that we do something to correct what's going on. We don't need to become an epicenter. If we don't do anything about this, if we don't make everybody wear a mask for the time period, people are going to die. They're going to die alone in a hospital. We need to take charge. Thank you for your time.
All right. Rob, I'm going to try and get this name right. Des Rousseau. Going once. Going twice. All right. Sarah Marin.
Don't they have to raise their hand?
I am asking them to unmute.
Are they raising their hand?
They're not, but
Well, then I wouldn't pick on them. I mean, I wouldn't.
I figured there were only 4. We could just roll call them real quick and be done. And then Melissa Zala. Commissioners, looks like we have no more takers.
Okay. With that, we normally take a 10:30 break for our closed captioning. I don't see Bob. So I believe we'll take 10 minutes at this time. Thank you.
Yeah. They'll let them know. What? No.
We've reached the commissioner comment portion of our comments. Can I ask if any commissioner has a comment that doesn't have anything to do with what we're talking about? No? Okay, with that said, we'll go to Department 9, discussion and consideration of a draft emergency order regarding face coverings.
Yes, Mr. Chair, Sarah Woods, County Attorney. Pursuant to the board's June 12th direction at their special meeting, I drafted a proposed emergency order requiring, in one instance, requiring or strongly encouraging those working in restaurants, grocery stores, food service, as well as businesses where social distancing is not possible to wear face coverings. The draft emergency order, which is attached to your agenda item, was discussed at the board's June 16th meeting. The board did not take action and directed the county attorney to prepare an agenda item for its special COVID-19 meeting today. During the board's June 6th meeting, there were proposals from Commissioner Campy and Smith concerning additional language regarding a sign requirement to alert citizens of a business's face covering requirements for its employees. One of the alternates was that a sign had to say that the business was requiring face coverings, as well as the other proposal was that there be a sign alerting patrons that the business was not requiring face coverings. And to that end, I've attached the same draft ordinance, which can be mandatory or strongly encouraging. And on the last page, I have the two alternate languages that we discussed. And with that, I await your direction.
Okay. We have, if you'd hold just a minute, is Narissa going to do a?
We have Narissa ready, yep.
Okay.
I think Commissioner Hetherington was going to ask when it was her, but that's
sorry.
fine, yeah.
I can't read mine, so.
No, and you can't talk to each other.
Yeah, that's true.
About business.
Okay.
Narissa Okie, Office of Tourism and Marketing here, and I was asked to talk about the tourism efforts as it relates to tourism and safety, which does tie into the mask discussion we're having. So we are looking at a way to do a support local business while helping with the safety concerns that are taking place. There's a lot of different factors that we've been looking at. Next slide, please. Sorry. So we want to bolster consumer confidence and support local businesses while positioning Martin County as having high standards in health and cleanliness to encourage shopping, dining, and leisure by consumers when appropriate. Next slide, please. So the purpose and what we're really looking at doing is it's a voluntary pledge that businesses take. They take this pledge and they're landed on a dedicated page. So you pledge to do as a business these CDC guidelines. And with this, you're then posted on a dedicated landing page. So there's excuse me, my glasses are fogging up, an added benefit of getting some promotion for doing these things. So you're taking the pledge. Next slide, please. It should go through it. Next slide. Next slide. You're able to download some social distancing tools should you decide to use them, such as the 6 feet apart social distancing plaques on the ground. Next slide. And then this is the slide. You get this sign, or this kind of ties into the sign discussion. So it's a sign that you can use as a banner, and it says, as our part to protect Paradise, we are doing these things. So we're asking you to wear a face mask while you're in our vicinity, maintain social distancing, frequently wash your hands, and avoid high-touch surfaces. So this is and when we were asked to discuss this is a sign that businesses can use. It's not a regulatory sign, but you have access to it if you've taken this pledge and decided you want to be one of these businesses. Next slide, please. There's a dedicated website, martintogether.com, where this is housed. This follows the BOCC communication strategy that they've been using. And this is what that looks like. And it should automate. Maybe not. Oh, there you go. So you sign on, and as a business owner, you are committed to following these guidelines, and you take the pledge. Next slide. There we go. And these are the components of the pledge. These are some businesses that we worked with to make sure that these guidelines and what's being required is doable, that we're not looking for things that are outside of the CDC guidelines or outside of things that are being recommended. So the businesses that are listed there have already signed up and gone through those things. And then we have links, of course, to Florida's reopening guidelines. You could, click that through again. And we can slow it down or actually go to the website if the commissioners would like to read it directly. But it has links to the Martin County website, the Department of Health, and all of the relevant businesses here. Next slide. We're going to be using the hashtag Martin Together to promote the businesses that are signing up and doing this. And then any questions. And if you want to go directly to the website, we can do that to slow it down a little bit. So this gives you the component of a sign that you're participating in this program. This is something that tourism was doing anyway, but we kind of got a call on what's the tourism impact, or what are you looking at from tourism to really help instill consumer confidence when we are, martintogether.com. When we're dealing with this situation in a very split philosophy on things. So, I guess we can open it up for questions, but this is the tourism, this is what tourism was looking to do. This is our version of a shop local campaign where we are promoting the businesses that are participating in this. So there's marketing dollars that are being put behind this. They can download the items should they want to download those items. We have also talked to Susan Corres and the CRAs, and she's interested in instituting this and getting the CRA businesses involved with it as well.
Any questions for Narissa? Yes, Commissioner Heatherton.
I was just going to say, as I was making my trip home from North Carolina and driving, and of note, in North Carolina, just about 100% of businesses that we went in, the workers, whether it be a shop, restaurant, were all wearing masks, and patrons, not 100%, but a good amount. I inquired quite often in the town or the county whether they had a mandatory. Almost 100% of the time it wasn't mandatory. It was implemented by businesses or patrons had requested it. So as I was driving home, stopping in little places, and I saw there was a Advent Health had billboards along the highway, and they were encouraging mask wearing, and I thought, regardless of the way this commission goes, whether it's encouraging or requiring, there has to be a component of involving our community, our businesses, for participation, because if it's mandatory, it requires participation. And education, if you look at texting and driving, they didn't implement mandatory, no texting and driving without an entire education campaign. So it is absolutely vital that we have buy-in from all parts of our community. We can't do it alone, even if we walked out of here today with this executive order with a mandatory mask restriction. There's no way we can achieve the desired result without involving the businesses. I called many businesses while we were on the road back. Some of them were already participating. Some of them weren't even aware of a mask, that the purpose of a mask. It's to protect others. They had misconceptions of, the purpose of a mask. Some of them said, well, we really would rather not, but if our customers, if we have something, and I believe with that business group participation, we could do this. So I had called Narissa and I said, I called business groups and I called businesses and I had called Narissa and I said, you know what I've been seeing on the road and what would be great? And she said, of course, we're already on the way and we're ready to launch that this week. So I thought it would be great that you would come and show what you guys were getting ready to launch, and I have no doubt that you were ahead of the curve. And I have some more comments, but regarding this, that's it.
Okay. Anybody else have any questions for Narissa or, yes, ma'am?
It occurs to me that not everybody in the room was here on Tuesday when we discussed it. If if you would like, we can put the draft emergency order up, and I can go through it again if you think that would be helpful.
Sure.
Because we had discussed before, we can certainly do that.
You want to speak before or after that?
Before she does that,
Okay.
can we go back to this? Completely unrelated, but absolutely related to the campaign. In downtown Stewart last night at dinner, the staff was sharing with me their absolute meltdown concern relative to the bridge closure, and that the messaging that is being popped out there is that stay away from downtown Stewart, because if, for those of you who are in this end of town, have realized it's anywhere from an hour to an hour and a half to get out of this place and head north to get around, whether you go via 95 Turnpike or you go up Indian River Drive or A1A on the island. And so, ironic that you would reach out to NERSA. I also did as well, that can we please add into this pitch, if you will, not only the safety concerns of relative to that, but the fact that, yes, downtown Stewart has its northbound connection cut off, but that they are there, they're open, they're functioning, and I think we've, as much as this other conversation we've had all morning is paramount to today's discussion, that piece has to be considered and important, that we are messaging that Stewart is there, they're open, there are ways to get there. Ironically to this whole issue, again, for those of you who travel from this spot here or are coming through this part of town, if you leave here at 5 o'clock, 4 o'clock, 6 o'clock, up until 7-ish, if you head west into Stewart, there's absolutely zero traffic going westbound, and once you're in downtown Stewart, there is zero traffic in downtown. So if we can connect that messaging and blend that into the overall conversation, and I don't want to distract from the medical side, the healthcare side of this issue, but please do include that for Stewart.
Yeah, we have shared that out socially, and then the Martha Ann here also amplified it, and downtown Stewart has amplified that messaging. The pushback we did get when we messaged that Stewart is open, where there were concerns about masks. I mean, those are some of the comments that we got in response to social media. Are we encouraging, as the tourism office, people to go down and spread the virus and stuff like this? So this is the response, or this is the program we had in place to kind of alleviate that consumer fear and get consumer confidence up. It's really voluntary in terms of what the businesses are doing, but of course we'll message probably, in tandem with this, that they are open despite the bridge closure and everything like that.
Well, and again, I mean, and this will be part of this overall conversation, I suspect, I know, but there will be those people who will reject the idea of what's being asked for today. There will be those that absolutely, as we have heard through the public comment, the mandatory want and need to do so, plus all the folks here this morning. At the end of the day, it'll be up to people to make those choices on their own.
Yep.
But at the same time, the negativity coming out of the bridge issue relative to its closure and the traffic issues of surrounding downtown just adds on one more layer of issue that from the tourism side of this and in our sort of shop local, buy local piece of all this, I just don't think we can push that on the side, regardless of what people's feelings are of this other conversation.
Yeah, this is completely voluntary. There's dollars associated with this, so there's incentive if you want to take the pledge, but this is not, we had this in the works before the other discussion.
Great.
Any other questions on the pledge, or did anyone need to see anything in
job,
terms
by
of
the
the details? Thank you.
Okay, yeah.
Thank you.
Mr. Hurd, can Sarah do her presentation?
It does not. It has to do with the proposal for mandatory masks.
Okay. But I'm asking you, would you want to wait till after she's done with her going over the draft?
Sure.
Okay.
Okay. Just to refresh all our memories, and I don't know if it's possible that we can pull that up.
I don't see it, Sarah, unless
It
it's
was
in the...
part of the agenda.
Or the agenda packet.
So for the, I'm not going to go through all of the whereas clauses because a lot of them just lay the basis for the COVID-19 crisis. The pertinent ones recite the CDC and Department of Health findings. Cleveland Clinic have recommended that all persons wear cloth face coverings, and the CDC that we need to take additional steps to minimize the spread of COVID-19, and then the most pertinent whereas paragraph says Martin County believes that an either requiring, which is the mandatory, or strongly encouraging individuals serving the public to wear cloth face coverings will significantly help reduce the spread of COVID-19 and lessen the positive cases in Martin County. The meat of the emergency order is as follows. All persons working in restaurants, grocery stores, food service, any retail establishment, or businesses open to the public, or any other location visited by the public where social distancing is not possible within incorporated and unincorporated Martin County shall or are strongly encouraged to wear face coverings. The next section was all other persons physically present in any public place in Martin County are strongly encouraged to wear face coverings. There then follows a description. A face covering includes any covering which snugly covers over the nose and mouth, whether store-bought or homemade, which is secured in place. Persons who wear masks should review the CDC and Florida Department of Health guidelines regarding properly and safely applying and removing and cleaning masks. Paragraph 4 is medical and surgical masks, such as N95 masks or other similar medical surgical masks should be reserved for healthcare personnel, police, firefighters, emergency management, and other first responders engaged in life safety activities. Paragraph 5, a face covering shall not be required for persons who have trouble breathing due to chronic pre-existing condition, and then some provisions about conflict with other orders. I will say that as we have put in most emergency orders, we do make reference to enforcement under 252.47 throughout the state of Florida, depending on what the requirement is. Many counties don't have an enforcement mechanism procedure for it if it's aspirational rather than mandatory. I will tell you that on Wednesday, as I think we've noticed, Monroe County went the emergency ordinance route and did a mandatory requirement for a year requiring that. The different options that were discussed on Tuesday, option 1, which is under the section alternate sign language, it was any business that does not comply with the provisions of paragraph 1 shall place a sign on all entrances that is clearly visible to the public prior to entering that states this establishment does not require its employees to wear face coverings as either required or encouraged by Martin County Emergency Order 2011. The other option that was proposed, I believe, by Commissioner Smith was any business who complies with the provisions of paragraph 1 above shall place a sign on all entrances that is clearly visible to the public prior to entering any facility that states this establishment requires its employees to wear face coverings as required or encouraged by Martin County Emergency Order 2011. And I'll take any questions, comments. Thank you.
Any questions for Sarah? Stacy, specific to Sarah's? Go ahead.
Yep. Just a couple questions. So on line number 5, it says face covering shall not be required for persons who have trouble breathing due to chronic. Would it make sense to put something rather than that medically exempt? I don't know if there might be more than one other than trouble breathing.
We took this from other orders. We could certainly say for medical reasons. You know, it's in pink because it was meant for the less mandatory, but we really, whatever the will of the board is, certainly.
And then it does say all, but is there a particular age limit? I mean, I've seen other ordinances where they've said children over 6, you know, or, so it doesn't really indicate in this.
Well, we talked about that in the section 1 that talks about all persons working in restaurants. It's talking about people working in the businesses, and I don't think you have anybody under 6 as all persons working in a restaurant. So
So this whole ordinance is crafted only for working?
For the people working. There's section 2 says all other persons, which are just the public at large, the patrons, physically present in any place are strongly encouraged. I think we probably should add an exemption for children under 2. That certainly is a good clarification we could put in there for the second one, but the first section is just for the employees. That was the board direction from last week's COVID-19 meeting that we received. It was never for everyone.
Okay, I think it would certainly be helpful to define the age, and I was confused that this was applying to all residents, not just employees.
It's the employees of certain, or where they were, certain businesses or other locations where the public can't achieve social distancing.
Okay. That's all. I have more questions.
Any other
For now.
questions for Commissioner Hurd.
Yeah, well, the evidence and statistics in Martin County on COVID-19 are unequivocal, and they're overwhelming, and they're sobering. It's clear that we are in the midst of a rapidly surging health crisis here in Martin County, which demands that we take transformative action. So I'm going to move that we require masks, the more restrictive language in this ordinance.
Commissioner Campy.
Thank you. Commissioner Hurd, or maybe Mrs. Woods, the language here is similar or exactly the same as the language we were discussing on Tuesday, which is shall. Commissioner Hurd, you're saying shall, the green, yes. Correct? Shall was for employees, based on the language that you discussed, but number 2 is a strongly encourage for the general public, correct? I have been, obviously, like my colleagues, really thinking about this and gathering all sorts of information. Some I went out looking for and requesting, others came to me whether I wanted it or not. And if you had asked me a month ago would I support something like this, I probably would have said no. Because I think we're sort of in an evolution here. And for quite a long time, I was saying, because I leaned on sort of more on the personal freedom side and, and that mindset. But if you go back and look at the meetings where I was recorded in my comments, I said, I really focus on how many people are in the hospital, how many people are in the ICU, how many people are passing away. I had also used the explanation that the reason our Martin County numbers were higher is because we were doing a better job of testing. So then I started to look at the research I started to research and look at the numbers that were happening in St. Lucie and in Indian River. And, and within full transparency, I have become, over the last several years with Mr. Lord from hepatitis A and other issues, I count him as a friend, but also as an excellent resource and advisor. And a calm, rational person. He's not a zealot. He's not like a beat-the-drum kind of a person. I know that when he comes forward, he's giving information that is clear and concise. But even if we put him aside, Carol Ann Vitani and Carlette Peck, both excellent leaders at the health department. I've had an opportunity to know them and work with them, and I ask them, for their advice. But then on Tuesday, we had a couple of doctors come. And since then, I think all of us have seen a tremendous amount of emails from medical professionals, people that have trained and studied and educated themselves in the field and have decades and decades of experience, universally said the same exact thing. There wasn't, as Mr. Lord had said, there wasn't like, well, 60% of doctors feel that it should be this, and I have 1 or 2 friends that are in the medical profession who are strongly opposed to any mask regulations. And we've seen recently an uptick in the last 48 hours or so of a lot of sort of much more like, don't do this, this is terrible, and we can't do it. Also including links to either YouTube videos or some other information, and I watched the links, and I went to see who are these people speaking. Are they medical professionals? Are they representing medical organizations? And they were not. Some of them were just very polished, articulate speakers that are opposed to this level of information. Even on the way here, I was leaning towards the pink version, the more relaxed or mild version of what we were looking to do here today. And I got a call on the way here because I've heard my younger children who are 19 saying that they now know a couple of friends from school that have tested positive. Okay? And then on the way here, I got a phone call from a mom who said it wasn't just 1 or 2 that had tested positive. Actually, it's 9. They were all together recently at an event, obviously not wearing masks or social distancing, and they were tested this weekend, and the results are back. 9 of the group had tested positive, and these are approximately 19-year-olds. So I find these things are like messages coming to me, and I've read every email, and I'm sure all my colleagues do as well. I've been trying to research online, I've been trying to research through the media, but sifting through, some of the stuff that's crazy talk and some of the stuff. And I will second Commissioner Hurd's motion because I think if we're going to be judged by our constituents, or more importantly by history, I want to be on the right side of this. And to me, there's no downside of asking employees and employers that have professional businesses. They're open, they're in business, their employees are working, they're collecting paychecks, and that's what we really tried to focus our attention on. I don't see this as anti-business. I really don't. I don't see that we haven't asked them to do anything dramatic. This is, in the very least, a sacrifice. And I will tell you, and Commissioner Smith had brought this up several meetings ago, that in his excursions around town, he had seen a lot of businesses actually following the rules. I know there's websites that are popping up that are saying these are the businesses that are following the rules. I've seen places that have had plexiglass up in between the cash register and the customers paying. And then I've seen some of that plexiglass come down recently because people were starting to think, well, maybe we're on the other side of this already. Well, from a professional, a leadership in the community point of view, I don't think we're there. I think, if anything, we're trending in the opposite direction. And I'm all about personal freedom. We're not asking the general public at this particular time, but I will tell you that if in the future these numbers continue to get worse and worse, that might be something that we'd have to look into. Reasonable people can disagree on this and be upset, but I would say from the feedback that I've received from the people who are educated and professionals in this field, it's universal and unanimous that they want us to take this step. I think from a business point of view, it could benefit businesses that will allow their employees to come in knowing that they're protected. There have been some businesses that stand out in my mind that have done a remarkably great job of even creating a scenario, an environment where the customers feel comfortable and safe. And if wearing a mask is part of that new dynamic of making your customers feel comfortable and safe in your establishment, that's a business benefit. That's not us hurting business. Thank you, Mr. Chair.
Yeah. Okay. Commissioner Smith, I was thinking of saying something.
Go ahead.
Go ahead.
No, go.
Well, I got to tell you, if you'd asked me where I was a week and a half ago, it's a little bit different where I'm at now after experiencing something where I really thought that I was exposed. And it took 2 negative tests of the person that I was potentially exposed to release my anxiety. It went through the roof. I have a little bit different respect for it right now. I was not for making anything mandatory, and I still have a little issue with doing something that's mandatory that is completely unenforceable. But at the food worker level and employees that can't social distance, I'm there. As far as construction workers working on a construction site. I hope that we're not having people that are exercise yeah. They're not, obviously on a construction site, so that's not going to be, I can't believe I'm fumbling here, but I have kind of changed my level of concern dramatically after seeing these numbers, and especially what really hit me was Carolyn telling us that she's got 80 in the pipeline right now. That's scary stuff. It really is. Commissioner Smith.
Thank you, Mr. Chair. So all of us have been doing a lot of thinking about this. It's interesting hearing all the various sides, various perspectives. It's also interesting being around the community and seeing what people are doing and what they're not doing. At dinner last night, I will tell you that 100% of the people at dinner were not wearing masks. We were at a table of 2 because there were only 2 of us. But most of the tables were 4 to 6 individuals, and they were sitting right next to each other, and there was absolutely no way that you could have done 6-foot separation in that instance. But that varies in the community significantly. There are some places that people are doing it, some people are not. It seems very clear to me that there is absolutely an age and a gap between maybe under 40 and over 40 in terms of how people are reacting to all this. There's an awful lot of compelling information that we have been given last week and this week, and very much appreciate it all. I have very conflicted opinions about this whole thing, very much like my colleagues. I very much come from a perspective that I, at the very best, do not want to sit in this seat and give direction to people and tell them how to conduct their personal life. That is not how I process, generally speaking. I think this time is different. I think this is an issue that we have all got to come to grips with. But there is a but here, and it's something that no one has yet discussed, no one has yet pushed out there, and I'm willing, more than willing, I am 100% supportive of going where it's being asked to go this morning. But at the same time, from our healthcare experts and professionals, and I don't know who wants to, and you don't have to come up and speak this morning if you don't choose to want to do so. What concerns me greatly, and everybody can look at these numbers any way they want to look at them. Everybody's got their own way of mathematically pushing, crunching, coming up with their own numbers. In May, Stewart and Indiantown, respectively, had 138 and 145 cases. In June, Stewart's cases have jumped to 573, and Indiantown's have jumped to 534. 12 times the amount of any one of our other communities. I have not heard any of our healthcare experts, professionals get up and discuss we have got to do something differently than what is going on apparently in 2 of our communities. I don't for a second suspect that those aren't real numbers. They're absolutely real, and I believe that they're positive and they're being reported and they're being dealt with. But we have got to get a handle on those 2 communities, because the other numbers are not driving the concerns that have been spoken about this morning or last week. They have gone up some, but not 12 times any one of our other communities. It's exponentially dramatic in Indiantown and portions of Stewart. And so I don't know what we need to ask of the governor. I don't know what we need to ask of our healthcare professionals. I don't know what we need to do. We can mandate today, and probably will, that everybody wear masks. And I think all the evidence presented this morning is very compelling that it's the right thing to do. But if we all don't get a handle, and we all don't get a handle on what's going on with Indiantown and Stewart, the mask won't make any difference. Because apparently they're not, in any case. You can't have 12 times the increase in those two jurisdictions than every other jurisdiction in Martin County and not think that there's a huge problem going on that we're not addressing, apparently. I know we have tried. I know we have stepped up those efforts, but it's not enough. And so, the cry, the absolute medical professional cry should be, deal with this, figure this out. Because if we don't stop it, my fear is what's happening is that those individuals that are in those communities are commuting, they're working, they're whatever they're doing in their work lives, and it's moving into all the other communities. Rob, I'm Mr. Chair, if it's okay, Rob's wants to come on. I'm more than happy to
Well, I just want to
dialogue.
say something to defend Indiantown. It's, we're labeling it as Indiantown. We're labeling it as Stewart. We could label it as a neighborhood because it's not all of Indiantown.
And that's maybe...
So I really don't want to give the impression that, you don't need to drive through Indiantown because it's...
But my point, Harold, is the way it's being reported...
I get it.
Is Indiantown and Stewart.
Yep.
And it may be neighborhoods, but we have got, in my opinion, all of what we're discussing, everything that has been asked of us to do today, we have got to take this on in a whole nother way than what we're taking on, because from May to today, the numbers have dramatically gone off the chart. But they haven't in the other jurisdictions of Martin County. And so, look, I've gotten over this idea that we shouldn't tell people what to do, what not to do. At this point, I think it's the right thing to do, and until we get some sort of reverse trend in where we're going, absolutely. But we got to get a handle on this other thing.
The evidence that we've seen, I think you're spot on, Commissioner Smith. First of all, there's a huge socioeconomic component to this. The communities that live in tight quarters, where their housing conditions are dense, where they don't have options. If I develop symptoms, I'm going to go check into a hotel, or I'll do something, find some way to protect my family. These people just don't have the economic means to do that. So we're seeing that. That's sort of the epicenter. And then to the last point that you made is what concerns me greatly, is we all shop in the same places. We've been talking a lot about shopping and retail businesses. So that's how it spreads. So then it goes from being a problem that is limited to a particular demographic, and then it spreads out to the general community because we go to the same grocery stores and we go to things. But to your point, I know that we've been involved in numerous discussions with the health department, trying to figure out this jigsaw puzzle that is finding a way to isolate these patients from their family members early on, identify them, keep them from going to work, which is a particular challenge. Many of them are under, as I understand it, they may lose their job if they don't show up. So those sorts of things, we need to work with the agricultural communities where they work, quite often outside of our county. So we're trying to have a conversation with a business in western Palm Beach County that none of us have any authority over. It's a very, very complicated issue. But your issue is very well taken. It is a problem, but what I would assure you is I know the health department is working hard on it. I know our team is trying to assist any way we can, and it is a problem across the state. And my understanding from yesterday in a conversation I had is that the governor is very attentive to this issue that's rising up in the farm labor community principally, but also in African American communities throughout the state where you have a poverty issue, and in any area where you see that. What would the socioeconomic disparity in this illness is huge. And that's my feedback. Thank you.
And the only last point, and if I feel that everything should be out on the table in terms of what we are doing and what we are trying to do. If you took today's numbers because as it's being reported, and Rob, even in your first screen, the black screen with the 3 orange lines, or 3 lines going up, yellow, white, and orange rather, our numbers would be under Indian River County if we hadn't had the escalation in those 2 neighborhoods, or multiple neighborhoods. There are 1,107 as of today between the Indiantown neighborhoods and the Stewart neighborhoods, and there's 217 in the entire rest of the county, which puts us not far under, but puts us at about par with Indian River County. And so we are getting, again, depending on how anybody wants to look at numbers, the numbers cumulatively look off the chart. We are screaming in the wrong direction. And they are, if you cumulatively take those numbers. But if we were to fix or address or find out how to fix, and I know the effort has been Herculean to get to where we are even today within those communities, to try to help educate and understand how do we change the course of all this. We have got to step up and not putting all of it on anybody in this room. It's the collective mass of us have got to step up and figure out how to help fix that, because the rest of the community, I would argue, at 217 is doing their part. I mean, that's the crazy piece of this whole dynamic. We are at par with Indian River County in the rest of the county. But for these 2 pieces of our county, our numbers are off the chart, leading the state in some of those numbers. So, again, I think until we see a collective downturn, I think it's the right thing to do for the whole mandatory mask issue. For those that are disappointed in that part of the discussion, I think all the speakers this morning said all of us up here have the obligation to do what's right as a collective whole for our county, and I think at this point that's the collective right of the whole. Thank you.
Commissioner Heatherton.
I want to thank you, Mr. Lord, for bringing some of this data, because I found it interesting and alarming that our highest cases are in the ages now of 25 to 54, and not some of the vulnerable 65 and over population, but 25 to 54 are the highest cases. That I found curious. I found it interesting on the data that Indian River County has pretty much kept their curve flat. They haven't increased, and I certainly think it makes a powerful statement that all of your physicians are united. So I'm certainly willing to, and again, I just recounted when we were in North Carolina, there was not a mandatory provision, but nearly 100% of food service workers, grocery store workers were wearing face coverings. My 14-year-old works at Publix. He's required to wear a mask. Quite frankly, I wouldn't let him go to work without wearing a mask right now. And I understand that masks are to protect others from you, but I feel like it offers him some protection too, and keeps his hands out of his face, and a lot more benefits. So I'm willing to support, and I think that businesses should be taking those precautions. I wanted to clarify, because I've been inundated the last day with emails from parents who are interested, concerned about how this would impact their children wearing masks in school. So I need some clarification. How does this, I have been saying to them that, the school board, the school district are looking at guidance for starting schools, but I need some clarification on how does this impact, or does it at all, school children when they start school?
Commissioner Hetherington, the current draft of what we're talking about only mandates the wearing of masks for persons working in the enumerated businesses. So it would not, I would not interpret by any stretch that this would apply to requiring teachers. Section 2 is strongly encouraged for all other persons. So just to make this clear, this current draft, absent different direction, only mandates face masks for those working in restaurants, grocery stores, food service, or other businesses open to the public where social distancing is not possible. So it's not everybody. So I also have some, thank you for your questions. I've got some proposed language so we could maybe make it a little clear about who wouldn't be forced to. But under the way this currently is, no children would be, if you're only talking about requiring it for people who are in businesses, individuals under 2 aren't working in businesses, so it wouldn't apply. The other part is just encouraging.
So to make it very clear to the general public, this body is not making any decisions today on whether or not school children, when school
Absolutely
starts,
not.
have to wear face coverings or not.
Absolutely not. And if you'd like to add language that makes that clear so that people aren't confused, we can craft something to
The clearer
say
this
that.
can
I
be,
don't
the
think
better.
yeah, I mean, I think when it gets confusing is the difference between just requiring it of employees and requiring it everybody on both sides of a business, the patrons as well as the employees. So,
Okay, and then I think finally, again, I think it's a prudent thing to do for employees and those, but we have to get a handle on social distancing because this doesn't really address it, and I don't see social distancing anywhere, so I don't know where the enforcement is coming from, but if I take my walk, around, you can find 3 or 4 people deep in some restaurants, so with both of these, we have to maintain our education, and I just don't see, and I think there was an epidemiologist, Carlette, that mentioned how important social distancing is, and I feel like that has gotten completely lost. And we have to do, I think, more. And even with this, I think we have to do as much education. I love the safety pledge that Narissa brought forward. I think it's a fantastic, proactive, positive way to move forward and encourage businesses, because peers relating to other peers are what's going to really gain compliance. Is what we want is people to actually go out and follow these guidelines. So we need to really, I think, step it up. Enforcement on social distancing, I think there's a complete lack of social distancing, and it seems that everybody is in agreement on this, but we have to move forward with educating the public, and we have to double down on our education, I think. So I think that's all I have.
Okay. Commissioner Campy, we're there. We don't
Yes,
need
2
to sell it any
seconds.
further.
This is informational, not trying to convince my colleagues. One, I think that when we speak of the hotspots, we have to remember that those residents that live in the hotspots also make up a large percentage of our service workers across our entire economy. So for the folks that live in Palm City or Jensen or Hobestown, wherever else, you're not in a quote-unquote hotspot, and you think, look, I don't have to worry about that. You do. These individuals work in the stores and the businesses where we go. So you're not immune from the entire county. Secondly, I also want to stress that when we're talking about wearing masks for employees, we're not talking about wearing masks on your chin or around your neck. We're talking about people covering their noses and their mouths. Because just having a mask draped across your face that's not covering your nose or mouth doesn't count. And then finally, Ms. Woods, when you said about restaurant, food industries and businesses that really can't logically have social distancing, I don't want people to be like, well, that doesn't mean my business because I have a big store, so I'm not going to have our employees wear masks. Primarily, we're talking about if you have employees in an indoor established business, they should be wearing masks. If you're working at a nursery or a landscaping place or in construction or, you're driving in your car, we're not talking about that. But if you drive a taxi, we are. Thank you very much.
Commissioner Smith.
Yeah, just a question for Sarah to look into, and I don't know, and we have Marcia Powers with us here in the audience. Can we pass an ordinance that directs the school board to do something? I don't think we probably can. I mean, I think if the school board chose to want to do their own policy, that's something that the school board would have to decide, and I don't believe that, but I don't know.
Well, from my perspective, this is an emergency, or there's emergency orders, and then there's ordinances, and an ordinance is, something that goes into the code, similar to what Monroe County just did. I would think no, because they're in charge, the school district is in charge of the operational of within their schools, and I would hate to have that argument to make that somehow the county could tell the school district what to do,
Yeah,
so I don't think so.
It just struck me when Stacy was asking, like, I don't even know that we have, but maybe, so.
I was going to say that in the areas, when I was doing research the last couple of weeks, in the more broad areas where there are those requirements, there are often additional language in the Monroe ordinance or in the mandatory emergency orders, which exempt a broad range of folks. For example, there are some areas where it's not possible, and they do that. So.
Okay, we've reached the point where we're going to vote on this. Maybe not.
Just really quickly, and the way that came up, I've been inundated with confusion from the general public, and I just wanted to make it perfectly clear that we are not this body is not making decisions, for starting of schools. That's, being discussed, but that is not what we're doing, and there was a lot of confusion, so I just felt like it was important to make that perfectly clear.
And now we want to move this along. Yeah. I have a little bit of confusion, so I want to look to Commissioner Hurd. So what the motion was that we use the green mandatory language. It is only for the workers. We're using the pink strongly encouraged. And with the board's, with the motion maker's approval, I'd like to add would you like something that's more specific about the medical? I can have this other language, persons for whom a face covering would cause impairment due to an existing health condition. You had raised
I got that in.
I'm just asking Commissioner Hurd if.
Number 5.
That's to a chronic pre-existing condition, or is it clear to you all?
I think
Okay.
that 5 is clear enough for me.
Okay. And then that's
Good.
where we are. Thank you.
That's my motion, thanks.
Thank you.
We have a motion by Commissioner Hurd, seconded by Commissioner Campy.
Whoops.
Just one more clarification. Are we adding language that has children under 2 or?
They're not workers, so no.
Not
They're not
workers.
workers,
Okay,
then.
you're right. All right.
Yeah.
Okay, one more time. We have a motion by Commissioner Hurd, seconded by Commissioner Campy. All in favor?
Aye.
Aye. All opposed? Passes unanimously. Thank God.
Thank you. Mr. Chair, I'd like to thank my colleagues because I think by passing it unanimously, we send a motion to our frontline workers that we appreciate what they're doing, and we also send a clear message that we're united in this decision and that's not fractured. I think unanimous is fantastic. Thank you very much.
And also, I wanted to thank all of the physicians in the community who reached out to us. Not only was their message unanimous, but they were unfailingly polite in their correspondence with us, and that's greatly appreciated because I'm sure that some of them felt very, very strongly about this issue, but they were unfailingly polite, and I'm grateful.
Absolutely. Okay, we are going to power through lunch.
Yeah.
And we're going to finish, and we're going to do grants and aids. Ms. Brotherton has been waiting very patiently for a week now.
Yeah, and while Ms. Brotherton's coming up, we put this item together and we discussed it early on. And when we did that, some of the direction I was receiving from the commissioners was to essentially try to keep our millage constant and not have a tax increase this tax year. And also looking at our total dollars and how we're spending our dollars. All of that conversation was prior to my now different concern relative to our revenues in general. We will not get our revenues, our first wave of our sales tax, which is one of our larger revenues. We usually get over 16 million in that half-cent sales tax annually. We will not get those numbers till late next week. We're always 2 months behind from the state, and it's always toward the end of the month. So today, I still have huge concerns relative to what our budget's going to look like and being able to maintain a constant millage rate and not have a tax rate increase on top of everything else that we're dealing with. So when Ms. Brotherton put this item together and her team, it was based on that direction. So, you know, it's not her making a decision one way or another. It was a direction she got from us to let's keep these as constant as we can. So Christy, with that, I'll turn it over to you.
Okay, I'm going to do something a little different because I know our school board chair has another appointment, and she's got a speaker form. I'm going to actually take her before the item even gets off the ground, in case she needs to exit stage left.
Thank you, and thank you all for your hard work. I know these are not easy decisions to make during this crazy time, so thank you all. Today, I'm here as the CEO of the Early Learning Coalition, and before you today is our request for next year. But more importantly, there is a variance that we had to make this year to our grant. Our programs, 2 programs, one in Indiantown and one here in Stewart, are starting on Monday. Due to COVID, we had to make a few changes to how we test our students to see how the program performed, because DOE has ended all testing for the rest of the school year, so we don't have that ability right now. But we are going to create a method to show you all results at the end. We also had to reduce the number of children that we can serve due to CDC guidelines. So I just wanted to let you know that. We have already hired our teachers for this year, so I appreciate you supporting that. We have a bilingual teacher that is set to go starting on Monday. She'll be running the program at the YMCA in Indiantown. And then we have our teacher all set here in Stewart as well. So we would appreciate your support of that. And Pat Houston is here. If you have any questions about those changes that we had to make, we're here and available to answer any questions. So thank you.
Thank you. Ms. Brother.
Okay, Christy Brotherton, Purchasing Manager. Before you today is just a preliminary review of the fiscal year 21 grants and aid funding requests. As Ms. Krista stated, we received direction to hold the budget flat. Just to summarize quickly, we started the process in February, and the applications were due in the beginning of March, right before COVID had occurred. We received 24 not-for-profit agencies that had requested grants and aids. 4 of these applications received are for services mandated by Florida statute, and one of those requests did include a funding increase in the amount of $11,295.85 for New Horizons. 4 of these applications are for current county service contracts, which does include a previously negotiated increase in the amount of $11,321.98 for the Humane Society of the Treasure Coast. We did receive 4 applications that were new requests with a funding total of $169,000. Staff is recommending award of the grants at the fiscal year 2020 funding level, with the exception of New Horizons of the Treasure Coast, the Humane Society of the Treasure Coast, and Dory Schlossberg Driver Education. Just to quickly go over, New Horizons is requesting a 3% increase to help offset the cost of additional outpatient therapy staff. Again, this is a mandated request. The Humane Society's increase is for a previously negotiated contract, so that's already included. And then moving down to the Dory Schlossberg Driver Education. Previously in fiscal year 20, it was funded at $70,000. We received direction to bring that down to $35,000. These fees come from civil traffic penalties, we can only use those fees for driver's education, and I've been told that we can make adjustments if we do collect more fees than the $35,000 that is listed. So provided in this table are the staff recommendations, and we'll open it up to any discussion.
Can you scroll down to the people that were on last year's list that are not on this year's list, please? It's hard to see the chart. Can you explain who they?
Okay, so we have the only other that is listed is for Tykes and Teens. They did receive funding in fiscal year '20, but per board direction, they were to seek funding from the Children's Services Council for fiscal year '21. And then we also have the 4 new applicants, which is Caring Children, Clothing Children, Healthy Start, Light the World, and United Way.
Okay, a couple of questions for you. One, the new applicants, staff's recommendation is that none of them receive what they had requested, correct?
Correct.
And I do remember last year with Tykes and Teens that there was a conversation involving, that since they were young, their clientele is children, that they go to the Children's Services Council, and they have done that in the past and had funding, and they had done that again this year. I have an issue with the fact that they would have been removed this year in particular, because we took all of the children in Martin County during their spring break and told them they would not be returning back to school, and then they had to change their dynamic to do online learning, and then most of them lost a majority of their milestones, graduation from elementary, middle, and high school, sports seasons, proms, interaction with teachers. If we were ever going to fund the Tykes and Teens, it would be this year, because they have had to also, because of CDC guidelines, they can't even have their normal interaction with with a professional and the patient, if you will, or the child in person, further isolating these young people from the things that they need when they need them. Now, a year ago, I would say that their clientele struggles with this, with all sorts of issues, and now I think their clientele has multiplied exponentially. Children that normally were even-keeled and not depressed and not anxious, and now, because of what has been forced upon them, to now cut their funding. I remember in the past, my colleagues said, put your district funds where your mouth is, and I have done that. But I know that they have had thousands, like 4,000 or 5,000, and this was a couple of weeks ago. I think each of us got an opportunity to meet their new executive director or chairman, whatever his official title is. They have done thousands of teleconferences. They have taken on hundreds and hundreds of new first-time patients. Excuse me if that's not the right terminology. And to now not offer up the $50,000, I think would do them a tremendous disservice. I will continue to assist with district funds, but a $50,000 hit is very, very difficult for a segment of our population that is obviously most vulnerable at this time. I would make a motion that we add that one back in, please.
Commissioner Smith.
Yeah, thank you, Mr. Chair. Sarah, do you have any insight relative to the Children's Services Council, whether that's going to be funded or not?
We have opened up all of the agencies that we fund to make new applications in light of COVID, and we so far have granted over $500,000 in unfunded donations to deal with these. I don't recall whether Tykes and Teens was an applicant or not, but certainly we opened it up to, the Children's Services Council does fund Tykes and Teens.
So the $50,000 that was suggested by us last year to shift over to Children's Services Council would be included in their regular ask, or that would be an additional ask?
Don't know.
Can we find that out before we make this decision?
In the meantime, you want to do some public comment? Or- yeah.
I just had a,
What? Go.
just on the Tykes and Teens, I feel like I recall the conversation, and that was a long time ago, that this was a very, very tiny, tiny part. The budget was extremely large, if I remember, and funded somewhat by CSE and maybe some other funders, but this was a very small part of the budget. I would just be curious of, what their funding mechanism is, their budget, and what portion of this is part of that.
Krista, do you have that from last year? Is that possible to pull that up?
I can see it.
Well, to partially answer
Sure,
some
we'll
of
grab that.
Commissioner Heatherington's question, Mr. Chair, I know that a large portion of the funding that most not-for-profits get is through charitable donations, and we can all understand that charitable donations, based on the economy and everything else that's been happening, are down. And I'm not asking that we, give them any kind of an increase, but to keep them at least for one more year under these desperate circumstances. Last year, we increased the Treasure Coast Wildlife budget approximately $50,000, and I don't begrudge them. I know they're doing remarkable work. But and rest his soul, when Dan Martinelli came in basically the end of his life and requested strongly of us, we did include a $50,000 additional, nearly doubling their budget, and I'm happy for that organization. But let's also remember that what the work that Tykes and Teens is doing is now more important than ever before. The consequences of them not having the success in their programs is catastrophic. I'm trying to reach out to them, but I doubt we're going to get an answer that we're worth waiting and holding up the meeting for.
Dura, do you have a contact person that you can contact directly? Can you please do that for us? We need to know what their total budget is and how much they get from CSC. We'll see if we can't get an answer fairly quickly.
Okay, Mary Fields.
Good morning. Mary Fields with Volunteers in Medicine Clinic. In October, Volunteers in Medicine Clinic will be celebrating its 25th anniversary of providing an unduplicated service in Martin County, free medical care to low-income eligible residents of Martin County. So we want to thank you, commissioners and staff, for your continued support. Volunteers in Medicine has been continuously open during this COVID-19 outbreak, providing medical care, refilling medications, obtaining specialty care referrals, providing in-person and telemedicine visits. This Martin County grant provides a quarter of our annual budget, and along with additional grants, an annual gala, a golf tournament, and individual donations, VIM Clinic is able to keep its doors open and provide high-quality, free medical care to eligible residents in Martin County. And we are optimistic that both the fundraising events will happen in 2020. We consistently show that for each dollar given, $11 worth of medical care is provided. Because of the 100-plus medical and professional volunteers donating their time and expertise, the $4 million worth of care for our patients donated by Cleveland Clinic, Martin Health, and Diagnostic Imaging Services, and the in-kind donations of medications and medical supplies from our many partners in the community. So you, along with them, are truly giving the gift of health. And on behalf of our patients and staff, we thank you, and thank you for your consideration in our grant again.
Thank
Do
you.
you have any questions?
Any questions? Thank you. Thank you, ma'am.
Thanks.
See you, Mary.
Tara Sweeten.
Sweeten.
Hello. I'm here in support of the United Way of Martin County's Tools for Success program. Prior to COVID-19, approximately 52% of our local students lacked the resources to show up on the first day of school adequately prepared with the necessary supplies for academic success. Prior to COVID-19, 50% of Martin County teachers expressed that they spent over $500 of their own money on basic supplies for their students. With the financial hardships that face the entire entire world due to the pandemic, I can only imagine that in our community, those numbers will be significantly higher this August when our students return to their studies. They have already faced so many instructional challenges to no fault of our incredible school system that did everything within its power to rise to the occasion. Having basic supplies necessary for instruction should not be one of those challenges. The United Way of Martin County has taken on the task of engaging partners within the community to support our students and provide them with the necessary supplies for schools. We've been partners with the Martin County School District since the program's inception, placing over 190,000 supplies directly into each Title I elementary school classroom last year. This year, our original intention was to grow the program to serve all elementary schools with a 5-year goal of serving all Martin County schools. We've been in constant contact to address the changing needs of the students to best serve the district and students this year. This will mean individualized supply packs for each student, so there will no longer be communal supplies in each classroom. Packs will be appropriately supplied for each grade level. Due to the changing financial landscape in our community and the world, we have made the decision to provide both middle and high school students most in need with individual supply packs. This program was born from a quarterly community conversation that the United Way holds to bring nonprofit agencies, businesses, and community members to discuss issues of our community. There were so many supply drives around town, but no coordinated effort. We made it our mission to bring as many partners together as we could to make an organized effort that would meet both the district and students' needs. We brought many partners to the table to make this happen, including House of Hope, Healthy Start, the school district, the Education Foundation, Head Starts, and the faith community, to name a few. I'm asking that the Commission join the table and be one of those partners to help fund the effort of ensuring our students are adequately prepared with the necessary supplies for academic success. Please consider the grant submission by the United Way for the Tools for Success program.
We need more content. We still have it. Thank you very much. Any questions?
Well, I have Rachel here to help me with my statistics, if you have any questions on the demographics and who we're serving.
Any questions? Not seeing any. Thank you very much. We appreciate it.
Thank you.
All right, Ms. Karen Ripper has 3 minutes, or a minimum of 3 minutes, or whenever Dura gets
I'll be
back.
very quick.
Yeah.
I know everyone is ready to go to lunch. I just wanted to thank you all for the great support you give the Council on Aging of Martin County at the Kane Center for our seniors in Martin County. We are the lead agency for seniors in Martin County, as designated by the your Adult Aging and Disability Resource Center, which was formerly the Area Agency on Aging. Your dollars go a long way. It's a match for the governmental funds that we receive from the state and the feds, and we appreciate all your support, and I think you know everything, pretty much everything we do, but let's suffice it to say that during COVID, we have evolved a great deal. We sent out over 2,800 meals last week. Our dining centers we want to get open as soon as possible because seniors are really feeling the isolation and a lot of the things households are feeling during COVID as well. So thank you for your support, and we hope that our grant goes through, and anything that you need from us, if you have seniors you want to refer to us for anything, we have case managers, and we also provide mental health counseling now through our licensed clinical social worker for seniors. So thank you very much. Any questions?
Any questions for Karen? Seeing none, thank you, ma'am. I understand, Mr. Campa, you have
I do.
information you were looking
I
at?
had an opportunity to hear from Miss Paula Hunt, who has been with the Tykes and Teens for quite a long time. She said approximately their annual budget is about $5 million. They receive approximately $700,000 from the Children's Services Council and have not seen an increase, and wasn't bemoaning that, but hadn't seen an increase from that number for many years. That number's basically fixed. They get a large percentage of their budget from Medicare, but has not had an increase in their Medicare reimbursements in 28 years. And she also said that now not only are they seeing that they needed to focus their attention and services for the children, but now when families have either been staying at home or quarantined together, that they've also started to now include family counseling, because they can't just address the issues of the child and then send the child back into a family where they're all struggling. So now they're doing some family counseling. And they also had a system where patients and families would pay what they were financially able to pay as a way of getting some of the funding, based on what they could pay. And they have seen that nearly disappear because families just don't have the extra funds to pay. But the services don't go away. If anything, under the circumstances, the services are more needed now than ever before. And this is an issue, obviously, I'm passionate about, because I don't think we address in our community enough the stress and struggling and the distress that our children are under. We lead the state, or at least are in the top handful of child suicides in the state of Florida is here in Martin County. And we don't see a lot about it in the newspapers, but any of us that are parents or have children, these issues are very, very real in our community. And I think I'll pledge, Ms. Christ, I appreciate the mandate financially that you are under. I was part of putting you on that mandate. I will help find money elsewhere. I just think that these decreases, the consequences of these decreases are very, very dramatic, and we hurt our community if we don't look after our most needy, whether it's our seniors or our children. Thank you.
Yes, ma'am.
I do remember the conversation from last year. I do think it's a fraction of the budget, but I completely agree with Commissioner Campy's comments. We're in an extraordinary year, and I do believe the mental health components have been stressed to the maximum. So for this year, I would support second Commissioner Campy's motion to include Tykes and Teens for this year only back in.
So can I just ask for,
Excuse me? Go ahead.
Mr. Chair, thank you. Can I just ask for clarity then? So if the Children's Services Council, so would this, if this passes, will this allow, or does the Children's Services Council request not get asked and they aren't asked to fund it?
Well, I mean, we can stress that this is only for next year.
No, I understand, but so let's say we pass it, goes to Children's Services Council, they pass it.
Passing a different portion.
Huh?
If that's a general question, I would say that two things. One, Commissioner Hurd sits on the Children's Services Council, and she's here today, so she could obviously mention that we did, if it passes, include the $50,000. And two, I think with the varied assortment of services that they're offering, normally Children's Services Council, a not-for-profit has to say specifically what they're using the funding for. It's not a general, here's some additional money. So I think that based on the services that they're offering, one might have nothing to do with the other, but Commissioner Hurd can mention that during those deliberations that remind everybody on that board that we did step up for 50. And if, just to be clear, if next year we're in the same boat, and I know that we've mentioned it for 1 year, and I'm happy to have the 1 year, but we'll cross the bridge of what's necessary for 2021, 2022 next year. I might be making this, I'm hoping not to, but I could be making the same comments for next year as well. But I appreciate the support.
You look like you're going to say something.
I am.
Oh, you
I'm going to say that I'm not going to support the motion. I feel that this is operating in a vacuum, and when I think we're going to be making some major cuts in our budget preparations shortly, and I don't want to, I feel like we're stepping out of our lane here. So I think that we need to view all these additions and deletions at the same time rather than in a vacuum.
Well, Commissioner Hurd, just to that, we need to set the millage rate. That's why we're bringing this to you now. We try to get grants and aids. It'll be in your tentative budget, and you can still make changes at that time in July, but we can't set that tentative millage in July until we get this nailed down, because it is a big chunk of your budget. It's over $2 million.
I don't know what other deletions and additions you're going to be proposing.
Oh, I know.
That's why it's difficult, impossible for
Absolutely.
me to support it.
For this or in general?
In general, I'm not, we need to look at the budget comprehensively rather than piecemeal.
Commissioner Smith.
Yeah, just a quick thought. We'll have a second shot at this when we come back for final adoption. If the Children's Services Council chooses to do something, and if that, in my opinion, is the right place to fund these kinds of requests, if the 50,000, regardless of what it's needed for, if it's needed, it will be justifiable or justified at the Children's Services Council as to what their programmatic returns are on those funds. And we can certainly have the conversation in September after the millage is, if the millage, well, the millage will be set at a certain level. If we get feedback from Sarah that the Children's Services Council has opined on the funding number strategy, we can certainly remove it from the budget at that time.
Okay. Any other comments? We have a motion by Commissioner Campy, seconded.
This is just for this, George. This is just for the, yeah, he's got,
Do you have public comment specific to Department 3?
No. Well, I have public comment specific to Department 4, but not for the,
my motion is exclusively for the 50,000 for Tykes and
Department
Teens.
4? 3?
Department 3.
Okay, so we need to hear that public comment, correct?
Mr. Chair,
No.
may I clarify? My motion is specifically for the $50,000 for Tykes and Teens to be increased.
Okay, thank you for
Yeah.
clarifying that. I thought we were doing the whole thing.
No, sir.
Okay. So once again, we have a motion by Commissioner Campy, seconded by Commissioner Heatherington. All in favor?
Aye.
All right. All opposed?
Opposed?
Motion carries 4-1. Commissioner Hurd dissenting.
Now we can revert back to the rest of the agenda item, just to get some idea. And also, part of the recommendations within the agenda item, when you look at the recommendations, was talk about this year and programs like the Early Learning Coalition and Boys and Girls Club, where they were not able to get their programs up and running, even though they're on our list to receive funding. So their quarterly reporting or their metrics or whatever they provide to us are going to be skewed because of that. I would recommend that we continue that funding and not get bogged down in this year,
Absolutely.
because
No
this
doubt.
year we're good.
Right.
Let's look at next year.
I got it. Yep. Okay, with that said, any discussion on this item? Any motion on
For approval of the grants and aids.
Second.
Staff
Okay.
recommendation?
Yes.
Yes.
that? Okay, and with that, Mr. Stokas, please read us our public comment.
Chair, you have a few public comments regarding Department 4. The first one is from Deb Joy.
Department 3, George.
I'm sorry, Department 3. It says, last time it was Department 4. As the mom of 3 children navigating back to school gets stressful, our children see that stress. Now more than ever, I see the benefits of the Tools for Success program as more than just financial savings, but mental support for families who already are dealing with so much. Thank you, United Way for Tools of Success program. It makes such a difference. Next comment from Cassie Cadeau. The United Way efforts with Tools for Success helps so many families getting the needed supplies for our students. As a teacher at a Title I school, by getting most, if not all, needed school supplies donated, makes a huge difference in our students and is a great relief to our families. Students do not have to worry about getting the right school supplies, especially now going through these rough times. Many families are out of jobs and are struggling to stay afloat. The last thing we should need to worry about is school supplies for our students. Tools for Success is such an amazing organization with a great mission. Next comment, Jennifer Radcliffe. Thank you for your consideration in working with the Tools of Success program with the United Way. Last year, United Way was able to provide Pinewood Elementary students with 100% of their school supplies needed for the class. This lifted a tremendous economic burden from our families. We appreciate all of the support received and recommend that we continue to support the United Way in their efforts to help our families. Please feel free to contact me if you have any questions. Next comment, Grace Dixon. As an elementary school teacher, I have never had a class of students start off the school year as prepared as they did last year, thanks to the United Way Tools for Success program. My students started the school year with all of the materials needed for an easy start, and parents were relieved knowing that the kids had everything they needed. School supplies can be a huge strain not only on their budget, but oftentimes my own. As students who come from families who cannot afford supplies, I am left purchasing their supplies for them. Thank you, United Way, for your support of our PWE families and community. I hope this program continues for years to come. Next comment, Tracy Miller. Thank you for your consideration of the United Way Tools for Success program. The United Way is seeking support from our community to provide basic school supplies for the students. The United Way is a valued partner of the Martin County School District and is working diligently to provide supplies for students as they head back to school in August. Next comment. Mary M. Barnes. On behalf of families in Martin County living with challenges of Alzheimer's disease, Alzheimer's Community Care greatly appreciates the ongoing support it has received over the past several years from the Martin County Board of County Commissioners. Last year, your support allowed ACC to touch the lives of 237 Martin County patients and family caregivers through its dementia-specific services. Most recently, we have formed a vibrant partnership with the Council on Aging at the Kane Center to design a dementia-friendly community throughout Martin County. Thanks to the leadership of a national movement and proud member of Dementia Friendly American Network that is allowing individuals with dementia to age in place. This year's funding request includes support for ACC's 3 core services that provide a safety net for vulnerable families, our Family Nurse Consultant Program, where we anticipate serving 265 patients and caregivers, a 12% increase over last year. Our Specialized Adult Daycare Center in Stewart, a modest increase over last year, 62 patients and caregivers, and our ID Locator Service, in which we anticipate serving 45 patients. These 3 services are provided at no to or low cost, thanks to generous supporters like Martin County BOCC and surround caregivers and patients living with Alzheimer's disease or related dementia with the necessary tools and resources to keep them together in community safely. During these times of unusual stress brought upon us all as a result of the COVID-19 pandemic, ACC's dementia-specific services are especially important to families living with Alzheimer's. Without support that is provided through these wraparound services, Family Nurse Consultants, Specialized Alzheimer's Daycare, and ID Locator Services, caregivers would be ill-equipped to safely care for their loved ones with Alzheimer's. This would leave them with no option but to seek costly nursing home placement for their loved one, a scenario that now poses extreme health and safety risks for our community's most vulnerable residents. Governor DeSantis has deemed an operation of adult day centers to be part of our community's essential services. As such, ACC is proud to report that throughout these challenging times, all of our dementia-specific services have continued without interruption as we fulfill our pledge to place a safety net around patients and caregivers every day. Your support once again will allow hundreds of Martin County families to care for their loved ones for the Alzheimer's and thereby enable them to live together with dignity and safety throughout the disease progression. Thank you again for providing this funding opportunity. Next comment is from 211 Palm Beach Treasure Coast. 211 thanks to Martin County Commission for their ongoing support of our work. We helped 3,959 Martin residents last year, including 78 suicidal people. These numbers do not include those who contacted us and wish to remain anonymous. 211 Helpline operates 24/7 and has been depended on as a central hub for information during this pandemic. We are on the front lines of every disaster or issue facing our community, and we play a pivotal role in the provision of emergency information and to provide emotional support in times of crisis. All of our services are free, confidential, and there is no waiting list. During this time, our requests for help have almost doubled, with people worried about their health, their family, and their financial struggles. 211 is honored the public views us as being a vital resource. We could not do it without your funding and support. We asked for a very modest award of $12,000, and this year we're asking for a small increase of $1,000 to ensure we can continue to provide these crucial services explained in more detail in our grant application. Your support is added to dozens of other funding partners and multiplied to be available to provide 24/7 service to the residents of Martin County. We ask that you continue your support of this life-changing work. Thank you. Next comment is from Samantha Suffich. I am writing to you in support of Martin County Healthy Start Coalition request for funding through your grants and aids. Our request was to cover the cost of prenatal care for uninsured pregnant women. When we initially submitted our grant, we were semifinalists who received $100,000 from Impact 100 to purchase a mobile medical unit to provide mobile prenatal care services. Due to COVID-19, Impact 100 is no longer funding projects like this, and we are putting this project on hold. We are still seeking funding for prenatal care services for uninsured women. I now recognize our ask was significant and would like to ask the commissioners to reconsider staff recommendation not to fund these services. We have a special arrangement with providers where we cover $1,000 and the patient covers $400 for a total cost of $1,400 for prenatal care and delivery. If you're familiar with the cost of these services, these providers are very generous in covering thousands of dollars remaining. But the overall return on this investment is significant. According to the March and Dimes, a preterm baby can cost between $55,000 and $250,000. I understand if the county cannot fund our complete ask, but every $1,000 we invest in our uninsured residents, we could potentially save hundreds of thousands to ensure that every Martin County is born healthy. Thank you. I think the last comment. Good afternoon, commissioners and staff. In October, Volunteers in Medicine Clinic will be celebrating 25 years of providing an unduplicated service in Martin County.
We've already had that public comment.
Oh, sorry.
She gave us the in-person version.
Sorry, Mr. Chair, I started to turn into a little bit of a machine there. And then I don't believe I have anything else on Department 3. So we do have some other comments that have been received, but that's it.
Okay, back to the board. We have a motion by Commissioner Smith, seconded by Commissioner Campy. All in favor?
Aye.
Aye.
All opposed? Motion carries unanimously.
Mr. Chair, may I ask Ms. Krista a question? Ms. Krista, there's been some question about district discretionary funds and what they can and cannot be used for.
Yes, sir.
I, in the past, have utilized some of my discretionary district funds for organizations that I feel benefit directly members of my district constituents. I plan on continuing to do that. I just wanted to say it in a forum and discuss it because I think that if it's discretionary,
They're not, though, Commissioners Campion. They're very clear in the statutes what those funds can and cannot be spent on, and how the residents that are benefiting from those funds have to be within a certain area because they're the ones paying into your district. And so we had the clerk of the circuit court look into it for us and render her opinion, if you will, and she developed the form that we now require to be filled out. So they are restricted. They're not discretionary where you can just spend them on anything. They are, and I'll let Ms. Woods elaborate.
we don't have to continue.
Okay.
I just want to be clear that, one, I've never heard that before, that Carolyn Timmon was involved and that a form was made. I have no...
sent a memo out to all of you.
I don't remember seeing it, then I'm going to
Okay,
need to see
I'm
it again.
sorry.
And two, I understand that the money that's raised within the district would have to be spent within the district. But for instance, if I wanted to participate in the Tools for Success program at Palm City Elementary School or Hidden Oaks Middle School or Bessie Creek or Citrus Grove, that's in the district. Those are the constituents that live and pay taxes within the district. I don't understand how I could not participate.
That is the first prong of the analysis. The second prong is that it's for a governmental purpose, which would be, and so now what we're doing is that's required by the statute, so we would need to do that analysis, so.
Very well. I think I
assuming it
still
fits
fall
that.
within the limits of the governmental purpose if it's happening at a school. It's government. We'll bring it up again. I just wanted to mention it in front of my colleagues, because I don't get to speak to them outside of this meeting.
No, I appreciate that. And did any of the other ones, or did any of the other commissioners not see that memo in the form?
I got it.
I
You
saw
got it? Okay. Okay, I'll just make sure you get it. It was during everything else that was going on.
I have a couple of suggestions. George needs a tag team member for reading voluminous amounts of emails that they
Agreed. We
could go
just-
back and forth.
Yes, we had talked about that before, so we can do that.
Yeah, I couldn't have done what he did, but we could do better. And also, I did verify that the city of, or Village of Indiantown, just as an example, requires all emails that are going to be written or read into the record for public comment have to be submitted at 9 o'clock in the morning. Their meetings start at 6:30. I think we need to figure out where our cutoff is, because that got a little out of control.
Well, normally, public comment begins at 9:05, so I don't think that that's an unreasonable request, is to have those responses in prior, the agenda's out 3-4 days ahead.
But
I agree.
But it has to be, I mean, I would assume, I kind of see what's going on over there, is you're checking for appropriateness and what it is for, right? I mean, we need some time to do that. They can't really do that on the fly either.
Yeah, so we'll do a 9 o'clock cutoff.
Okay.
I'm seeing some heads nod, so I feel confident we can do that. We'll change the policy.
Commissioner Smith.
So, but you have agenda items where people are weighing in on agenda items, and there's not, you're not going to have a cutoff point. I mean, the idea behind doing this, I think, in general, was where people didn't feel comfortable participating in our meetings because we were to shut down or lock down or whatever we were at. When we have progressed into phase 2 of where we are as a society.
No. No.
Yep.
Huh?
He's telling me I'm not allowed to speak, but I'll speak anyway
He's
when
used
you're
all
done.
his words for the day.
And so, you know, the concern I have, if we get into limiting a cutoff time or any of that, is that someone will raise the red flag and say, yeah, but I couldn't participate because I don't feel I should be there, but I still feel I should have the right to comment at any time.
Well, again, their 9 o'clock cutoff is for everything. It's
No,
for
I have a
agenda
suggestion.
items and-
Harold, I understand. What I'm lobbying for is to maybe start to get back to normal, that
Okay.
we get away perhaps from this routine altogether, the Zoom thing, which I learned from the city of Stewart yesterday, and I had no idea that this was all going on, that there is an effort afoot to interject folks into that don't necessarily shouldn't be in the Zoom meeting.
They've had that happen twice, I think, to them.
And I've talked to Mike Merker about it, and he has assured me that we have perfectly adequate controls in place to protect ourselves. But there's equally a concern that nefarious things go on relative to how all that happens. And so I'm encouraging us to think about starting to get back to, we have a meeting, we have perfectly socially distanced, we passed a mask ordinance this morning. You know, please participate in our meetings at some point. So anyway, that's where I am on all that.
I don't think I'm there yet. But.
Yes.
You ready?
Yeah. Thank you so much, Mr. Chair, for allowing me to speak at the meeting. Appreciate it. To Commissioner
comments need
Smith's
to be
very
submitted at 9
legitimate
o'clock.
suggestion, that I agree with he raised that concern, is very simply, how about we make the cutoff that as the agenda item begins, that's when the cutoff is.
Okay.
So if it's at 1:30 in the afternoon and something comes up and someone wants to participate, Commissioner Smith's right. We put this in place so that we could offer our citizens that can't come the most opportunity to participate in public comment. So instead of saying it stops at the beginning of the meeting, we cut off any additional comments when the agenda item begins.
That's fine, and public, the general public can, once the agenda is approved, then that's our cutoff.
Right.
But we don't want someone to contact us and say, well, I wanted to say something, but I wasn't allowed.
No, but they'll be able to when the item
Right,
comes up.
right, even if it's in the afternoon. So I
Right.
think that's a excellent
So-
suggestion.
Just for clarification, general public comment is cut off at 9:05 or when the agenda is
9
approved?
o'clock.
Yes.
Yeah.
And agenda items is when?
Is the beginning of the agenda item.
Okay, so when we have a commission meeting like this and we open up a public hearing, or we do whatever we do, we go through the presentation, we have, depending upon who's part of the agenda, they speak on the agenda, we talk about the agenda, and then we open it up for public comment. So we don't cut off public comment at the beginning of the introduction of the agenda item. If someone were sitting in the audience, they would listen to the presentation, they would do whatever, and then you, Mr. Chair, would ask for public comment.
Well, I guess what you're saying is that instead of at the beginning of us discussing the item, it would be cut off when we begin public comment on that item? Is that where you're going?
That's how I understood it.
Yeah, okay. That
I
sounds
just,
reasonable.
yeah.
That was how I interpreted that.
Okay, I didn't.
Oh,
when I
okay.
was-
That's how I interpret it.
So, okay, fine, thanks.
That's not how I did either. I thought we were cutting it off once we started that item, so thank you for your clarification. That's, okay. Any other commissioner comments? Oh, come on, sir.
Dear Lord, put me out of my misery.
Okay, if I don't have any more comments, I think we're going to adjourn. Our upcoming meetings are June 26th, COVID meeting, July 2nd and July 10th, COVID meetings, special meetings, July 14th, 28th, regular meetings, July 20th and 21st is our budget workshop, and with that, we are adjourned.